pandemics has highlighted how at global level, collaboration across sectors and disciplines based on an holistic vision is the only mean to protect public health from present and future challenges concerning emerging and re-emerging zoonotic epidemics and pandemics, endemic zoonotic, neglected tropical and vector-borne diseases, food safety risks, and the silent pandemic of antimicrobial resistance. One area that has the potential to address these challenges is the intersection of health and space. Emerging technologies such as new satellites and new business models are also creating opportunities for innovative solutions where also space can play a role and bring added value to the healthcare sector in general, including medical and biomedical research, telemedicine, digital health, and more in general public health management. With this, I really would like to wish all of you a very nice and intense week of work. And again, I would like to thank WOA for the recent Memorandum of Understanding of Joint Action and for hosting us here in Paris. Thank you.
Thank you very much, Stefano. And now I give the floor to Alessandro, who will speak on behalf of ASIS, Teramo Institute, whom we have very long-lasting and strong partnerships, especially working on vector-borne diseases and eco-regionalization using Earth observation. Over to you, Alessandro.
Thank you, Shadia, for this kind of introduction. I will give a few words on behalf of my Director General, Nicola D'Alterio, that unfortunately for the last minute commitment couldn't come. Deputy Director General of WOA, representative of ESA, ladies and gentlemen, esteemed colleagues, it is a pleasure to take the floor at this EO4Health user forum, which brings together science, technology, and policy to explore how Earth observation can support the global health. At the ZOS of Teramo, we are proud to serve as WOA Collaborating Center, among others, on epidemiology, modeling, and surveillance. And for more than 2 decades, we have been using satellite data to study and try to anticipate vector-borne diseases working on the interface of climate, environment, and health. Thanks to WOA, we have been able to share our expertise in the use of satellite data both at the international level and with the relevant authorities through projects such as PROVNA in North Africa and PROVBA in Balkan areas. Thank you again for that. I'm proud to say that this approach has also attracted the attention of other international organizations. For instance, WHO Regional Office in Cairo has invited us recently to further explore the use of this methodology for monitoring and control of malaria in Eastern Mediterranean region. We have been engaged with ESA in 2 projects, IDEO and EO4Health Resilience, which strengthen the partnership between Earth observation and health, delivering innovative tools for monitoring vector and waterborne diseases. Building on this experience, we have just started a new ESA project within the Climate Space Initiative. This project focuses on the impact of climate change on health, with a special case of malaria in collaboration with WHO and other international partners. This year's one lesson has become clear. The challenge we face are both local and global. Climate change, land use, and biodiversity shifts are reshaping the distribution of vectors and zoonosis everywhere. No country and no institution can tackle these threats in isolation. Our main field of action is Mediterranean region. It is an hotspot where Europe, Africa, and Middle East meet, and a crossroad of migratory routes, ecological transition, and climate pressure. Here, the risk of zoonotic disease are real, increasing, and here cooperation between North and South is essential. But our responsibility does not end at the Mediterranean. The same dynamics, warming temperature, altered rainfall, and ecosystem change can drive the risk in other parts of Europe, Africa, and other parts of the globe. What we can learn in Mediterranean region, for example, from PROVNA project, can surely inform global resilience. To conclude, let me to emphasize 3 key messages. One, health must guide our work. Continuity is critical from stable Earth observation data stream, long-term health surveillance. We need sustained investment, and cooperation is the only path to do so. Colleagues, zoonosis and climate are two sides of the same coin. Monitoring and understanding them is a shared duty. Our change is global, and only by working together we can ensure preparedness, resilience, and a healthier future for all. Thank you.
Thank you very much, Alessandro, for your welcoming remarks and also for mentioning examples of where our work together in North Africa, but also recently in the Balkan region, and hopefully will expand more to other regions in the world. We will hear more about those projects tomorrow in the vector-borne disease dedicated days. Thank you. All right. Thank you so much. So we close now the welcoming remarks and we allow our Deputy DG to leave the room before we start the next panel. Thank you so much. Thank you. Yeah. Okay. Yeah. Yes, please. If I may ask Gordon and Jorge to come to the stage. There is no presentation. Okay, welcome. So for now, we will start the high-level panel on One Health and Earth observation. And we have with us a representative from ESA and also from the UN Office for Out of Space, UNOSA. And I will be representing WOHA from the international organizations. So I give the floor now to Stefano and Marie-Louise for the introduction of the panelists.
Thank you, Chadia. I have the pleasure to introduce the first panelist, which is representing WA in the panel. It's Chadia Vanous, is One Health Senior Specialist and Global Coordinator. Chadia is also working on preventing and reducing the risk of health threats at the human animal environment interface through the One Health approach. With this, I would like now to pass the floor to Marie-Louise for introducing the ESA speaker. Thank you.
Good morning, everyone. I'm introducing Gordon Campbell. He's the head of enterprise section in Earth Observation Programs Directorate in ESA, running programs to support Earth observation applications and service developments over a wide spectrum of domains, including law enforcement, industry sector operations, support environmental protection risk, and public health.
And the third panelist will be Jorge de Rio Vera. He is a Scientific Affairs Officer at the United Nations Office for Outer Space Affairs in Vienna. With more than 20 years of work in the space sector through agencies and international organizations, he has been working on European flagship space programs, particularly Copernicus and Galileo. Now at the United Nations, he provides assistance to the member states in areas like space technology and space for health in particular. Following an important United Nations General Assembly resolution on space and global health, he is working on paving the way for widespread use of space data technology and applications for health. And he supports the work of the United Nations established Space and Global Health Network.
Thank you so much. So the format of the panel, there will be no presentation. It's a panel discussion. We will start with the opening statements from the three of us, 5 minutes maximum. And then we will have a moderated discussion. We prepared some questions for the panelists. And then we will open the floor to the audience in the room to ask us or to comment on what you heard from our presentations. So maybe I will start with the statement from Muha. So again, welcome. It's a great honor to be with you here and to be on this panel on One Health. We meet here today at the time where the connections between animal health, human health, and the environment, has never been more evident or more urgent than now. So the One Health approach is no longer optional. It's an imperative. From zoonotic disease emergence to vector-borne disease to antimicrobial resistance to other health impacts of climate change and environmental degradations, our challenges are interconnected. And so are our responses. They must be interconnected. We need an integrated response across disciplines, sectors, and borders. The case of One Health couldn't be more clear. It is estimated now that 75% of emerging diseases and nearly all pandemics, they originate from increased interactions between animals and humans, causing over 1 billion infections and million deaths each year, alongside numerous economic losses and animal suffering. The current global concern around avian influenza underscored this reality. At the same time, the risk is also increasing. Human activities has already altered 75% of our terrestrial environment and 66% of marine ecosystem, with profound consequences for our economy, society, and the health system. So this is why prevention matters. A recent report estimates that the annual cost of prevention through the One Health approach, it's around 10 to 11 billion US dollar annually. But it's only about 1/3 of the cost of preparing to any outbreaks or pandemic. And of course, it's far less than the trillions of dollars we spent on responding to the COVID-19 pandemics. So prevention is not just the ethical path that we need to take, but also the economically sound one. Now, the World Health Organization for Animal Health, WHA, we have placed One Health at the heart of our mission. We support our member through our standard setting mandate, through providing guidance and through capacity building to strengthen the vet services and the animal health sectors to enhance their disease surveillance and to address the health threat at the interface, including zoonotic and vector-borne diseases. Beyond this technical work, WHA also plays a crucial role in advocacy and as a convening partner. We help countries to translate the One Health concept into practice, ensuring that animal health sector is fully engaged in the global health security. We also support delivering operational program like the one I mentioned on vector-borne disease that bring the One Health into practice. This work is further amplified through our quadripartite collaboration with FAO, UNEP, and WHO. We work together to provide leadership, tools, and coordinated strategies for global One Health governance. In this panel, we have the opportunity to reflect on how Earth observation can strengthen this effort by offering data, foresight, and predicting power that we need to anticipate the risk, to guide our intervention, and to support our member in protecting health across all domains. So I encourage our discussion to focus on this, on how we can deepen our collaboration to bridge data and governance gap and accelerate the translation of science into action. The One Health approach must remain not just a principle, but a practice that delivers tangible benefits for communities, for our animal health, for human health, and for the ecosystem worldwide. Thank you, and I look forward to our dialogue. Thank you. Use Gordon.
Okay. Okay. So good afternoon, everybody. Thank you for the invitation to participate to this really interesting event. Thank you to WOA for hosting us. It's a really impressive organisation. So my introductory comments will be or are linked to the opportunity for greater exploitation of Earth observation satellites. That's our mandate. I mean, what's been happening over the last 10 years, particularly in Europe, we've moved from public institutional satellites being very few in number to really, a complete step change in the number of satellites that are available and what can be done with them. There's new capabilities coming along, new instruments. We're able to measure new things. We have constellations that mean we can have maybe 20 years ago, we were lucky if we got one image every 2 or 3 days. Now we can have several images over a particular area, 10, 15, 20 per day. We can have nighttime image. We can have a whole bunch of new data collection capabilities. We have new AI capabilities coming along that let us extract information from these data sets, that let us develop more credible inference models, that let us do things like multi-data set fusion, etc. Very important for effective use of Earth observation. So we've been looking at the whole health domain and saying there must be, or hopefully there is more that we can do. I remember maybe 20 years ago, we did a project called Epidemio with EO at the end of it. And I think more or less all that we did was we had some vegetation indices and we got some vet schools to try and see how does this link to potential changes in transmissibility of I can't remember which diseases it was. It was maybe 1 or 2. Now I think the range of data that we can have, the performance that's there in terms of the update, the revisit, the complexity of the information, like I say, the AI inference, all of that it lets us do an awful lot more. And I think, given that we have these capabilities, given that we have a global data acquisition capability, it's not just something for Europe. This is satellites see everywhere. We can do something for absolutely, anywhere in the world. Having that capability, I think we've got a responsibility to say, how can we use this public investment in this technology really to support these sorts of efforts? If we can do that, I think this is something that we really have to be pushing now. And with this sort of step change in potential utility that we're going through now, this is an excellent time to be trying to ramp these things up. We're not just trying to push blindly the technology down people's throats. We know that we have to be working within established processes, within established working practices. The Earth observation will only be a small part of a much larger solution. And that's really what we're trying to understand here. How's that going to work? What's our little bit of it? And how can we work with everybody else in this room to ramp up from our little bit of our very limited technology to really something that is an effective, comprehensive solution to either current or emerging issues related to not just vector or waterborne diseases, any sort of public health challenge that we can try to apply these capabilities to. So that's, I think that's the main elements I would like to really sort of lay out here are, firstly, we know we're a technology agency. We know we've been doing a lot of technology push in the past. We're trying to keep it under control and have it in a context that is as useful as possible for the people that really are working in this domain. And we're trying to explore what that looks like in terms of getting the most useful capabilities out of these data sets, but also how do we move from just having something that works, and it might work with a very high technology situation, it might work in high income countries, whatever. How do we get this working everywhere for everybody? And what does that look like? What do we have to do on our side? Again, who do we have to be working with, etc., to make sure this is for everybody's benefit, not just for a number of people that have high performance computers or whatever. So that's the second part. Let's get this working for everybody, and what are the challenges, and what do we have to do about that? Thank you.
So over to you, Jorge.
Thank you. Thank you very much, Chadia. Thank you for the invitation. Thank you for hosting us to WOA, to the European Space Agency. Thank you to Stefano for his kind invitation and his engagement. I have a question for the people that is here. So I'm working in the United Nations Office for Outer Space Affairs. How many of you knew that such a thing existed before you heard about it today? 1, 2, 3, 4, 5, there, 6, 7. Okay, so much less than half. Okay, I have another question. So how many of you are doctors here? Doctors. Medical doctors. Yeah, no PhD. Medical doctors.
And vets.
Vet and vets, yeah.
And that's okay. Public health.
Okay, so less than the people that knew UNUSA. Okay, good. Just for me to have a picture of the people that we have here. So, as I said, I'm working for the Office for Outer Space Affairs of the United Nations, and yeah, as is not that well known, we are based in Vienna, and what we are doing is to try to help countries utilizing space better. You may think, okay, space, United Nations, that doesn't fit, but if you think about the areas where space can contribute to, is enormous. I mean, just looking down to Earth, you have food security, water management, energy, health, we are discussing health here, disaster management, emergency response, climate change, environmental impact, so basically you name it. But also looking up. In the office, we are also working in space sustainability to ensure that those satellites that are giving us precious data are actually working, and we are going to have satellites for a long time, and they are not going to be destroyed by a piece of debris. We are discussing about space resources. We are discussing about NEOs. What is going to happen if there is an asteroid coming to Earth, and how are we going to respond to that? So there are many, many things that we are discussing in the office, and we are 20 staff to handle all that. When we come to the discussion on health, the discussion on health in the office have been for a long time. It started with the third United Nations Conference on Space Exploration and the Peaceful Uses of Outer Space, and that was in 1999. So the office is basically, as I said, is helping member states to discuss on space matters. And they were all together, all the members of United Nations were together and were discussing about the space affairs in 1999. And they said that space for enhancing public health services was very important. And that kicked off a process. And that process culminated a couple of years ago with a General Assembly resolution that was recognizing especially that. It was a United Nations General Assembly resolution on space and global health, which is big. I mean, it's saying this is something that we all United Nations member states care about. That General Assembly resolution was basically not the end of the road. It was the start for doing a lot of things. And that resolution also did something that was very important for the office. That was the establishment of the Space and Global Health Network, which is a platform basically to gather exchanges between member states and United Nations entities and channel that through the Committee on the Peaceful Uses of Outer Space to the General Assembly. So that's a very important mechanism that is connecting science, research with policy. And that is established. And that network is reporting every year to the Committee on the Peaceful Uses of Outer Space, which is very important. As I said, that was the start for us of a road. And the first thing we did, we organized together with WHO a conference in Geneva in 2023. So the resolution was December 2022. In November 2023, we had a conference, an international conference on space and global health. And out of that conference, there were three main recommendations. The first one was to create an interdisciplinary curriculum on space and global health, because we saw that there was a clear gap between the space community and the health practitioners. And I mean, we can see here today, I mean, there are not so many medical doctors and vets and a lot of people from observation. We have to get that number 50-50 one of these days. Another recommendation was the creation of space-based essential health variables. That's mimicking something that exists in the climate environment, which are the essential climate variables. And why is that important? Because that is already putting the focus on what space can do and what are the things that need to be measured from space that can help the health practitioners. That also helps in having continuity of measurements. So like having those essential health variables, we are signaling space agencies that these are important. And the third recommendation, I said there were three, is a little bit more down the road, which is working in interoperability between space systems and health systems. So we are able to inject that data and medical doctors can use it better. Difficult stuff. What is next? So the Space and Global Health Network, as I mentioned, is already implementing some of those things. And the development of the curriculum is well advanced. It's going to be out probably in December, and you will be hearing about it during this week. The work that has to start, and there have been already conversations between European Space Agency, Space and Global Health Network and us, is on the space-based essential health variables, which is the next piece of the puzzle. And we are trying to pull that together, and there are policy opportunities that are coming up. There is one policy opportunity that is coming up that is called Unispace 4. I mentioned that the work on health started in 1999 with Unispace 3. There is going to be a Unispace 4, hopefully, in 2027. So it would be a beautiful moment to actually get something else to report to on health. And there are already things going on. So with that, I think, yes, as an opening, thank you.
Yeah. Thank you very much for your opening remarks. It's very great to see the progress that you are making within very short period of time, and to see that similar process has been done for climate change as well with the public health domain through the WHO. And what we hope that this will enlarge, scale up to be a One Health domain. So not just working with the public health, but also working with animal health and with other disciplines that need to get the space data to inform their interventions. I have a question for Gordon, if I may start the discussion. You talked a lot about access and how to make Earth observation used by everybody. This is very ambitious because even I know in our organizations, because we are not expert in using this technology or these innovative issues, we find it challenging to access them and to use them in our daily operations. So how do you see the role of ESA and other partners to find solutions and to make it more user-friendly for us in public health or in animal health?
Ooh, that's a hard question to start with. I mean, we glibly talk about, open access and, really expanding uptake, etc. Unless we're getting to, the elements that are inhibiting and preventing, and also looking at how do we encourage, we're not going to get anywhere. I think in a lot of cases, okay, the difficulties can be overstated to some extent. I mean, when Google Earth became available, everybody was suddenly an image analyst. I mean, great, okay. Now, what everybody did to start with was they did image analysis on their own house. My house on Google Earth, great. And then you start looking at other things, but people start, just fiddling around and actually doing some quite advanced thinking with the imagery without really appreciating that what they're actually doing is something quite complicated. So I think people do a lot of things without really appreciating that they are doing something quite complicated. I think we have to build on that. The second point, which we've seen in the past, is when we get out of imagery and into actual measurements, we're all the same. Somebody comes along with a new measurement, a new way of measuring something, like some parameter, and say, I'm using this sensor you've never seen before, and we're giving you measurements, and you don't know if this concentration estimate or whatever is as good as what you're using already. So you need to really do a technical effort with the reference people to make sure that you're building that confidence that what you're saying can actually be used in a similar way to the methodologies you're using already. I'll give you an example. We were looking at water quality monitoring in the Baltic. This was maybe 15 years ago. And all of the National Environment Protection Agency said, but you're not measuring the concentration, you're measuring something else, and then you're inferring the concentration of chlorophyll from that measurement, without appreciating the fact that the existing methodologies for measuring chlorophyll concentration are also measuring something else, and you make the inference. It's just that inference is something you're happy with. The inference from the new instrument it's different, because it's a different, but fundamentally it's the same process. So we have to build, expand the comfort zone to get that acceptance. Say, look, yes, it's different, but we've done all this technical assessment and exercises and demonstrations, and look, it's usable in the same way. I think the third thing is we have to be credible with the measurements that we're making, and say this, we can really demonstrate that this is what it is. There's a big effort on any technical community to do that, and then we have to really, if we want to expand and have this totally acceptable, it's how do we get out of a pure pay-per-use commercial way of thinking about these things and into how can these methodologies, these workflows be moved into a much more or a much less financially onerous situation. I mean, the costs of anything new like that, if there's a technical investment, somehow people want to recuperate that investment. I think we really need to think about how that's done, how methodologies such as open source can be used to keep things valid by the global community and reduce the access costs. And this is not something, we're not the only technology in the health sector where there's the discussion on how much things cost. So I think, we would look to also, you're dealing with this on a daily basis. I think you've probably got more useful experience or more applicable experience on how that can be dealt with than us. So I mean, that's why we want to be, well, it's part of the reason we will be working with you guys on dealing with this, like minimizing the impact of the financial implications on this so that we can get the stuff out and get it used. So these are, I think, are some of the points I think we would like to explore in getting this technology more usable, more user-friendly, more accepted, and just easier to use.
Jorge, I have a question for you. You mentioned 3 activities that are related to the UNGA resolution and also the recommendations stemming out of the Geneva conference. Now, how can we concretely support the implementation of these? And can you pick one of the 3 and try to think how we can add a little bit of meat into the process during this week? And the question is also related to the partners. I mean, you see here that there are various agencies that are dealing with One Health at large, both at UN or global level and at European Union level. So how do you see this collaboration moving forward? And you can, of course, also make reference to programs that have already been implemented. If you think the charter was also stemming out of the Unispace, and there are also the SDGs that have been widely addressed also in terms of health by different space agencies. So in a way, you didn't mention, but you are also a network of space agencies globally, which is quite an interesting mechanism. Thank you, Jorge.
Thank you, Stefano. So you were asking for a concrete example of how those recommendations are being implemented. I mean, I'm going to select the curriculum because that's going to be delivered very soon. So as I mentioned, there is the Space and Global Health Network that was established out of the General Assembly resolution. And that's a mechanism that is basically convening the experts in the medical domain and experts in the observation domain. And what they did was to basically run a consultative process in a very fast pace to build the curriculum. They run a Delphi process that it's basically an iterative process, and selection of topics and then prioritization of topics. And then the same community was picking up those topics and were developing them. And we have been having meetings discussing the different elements that are going below those topics. So it has been a completely collaborative process. So everybody that was part of the Space and Global Health Network was invited to discuss on that. It's very easy to become part of the Space and Global Health Network. They basically have a statement of intent that has to be signed, and it can be signed by individuals and organizations. So that's one example. The next stream of work that has to start is the one that I mentioned on the space-based essential health variables. And the conversations, as I said, I mean, we had informal conversations, Stefano, on that, together with the people on the Space and Global Health Network. But we have to find ways of moving that work forward and decide on which approach we are going to take. I mean, Gordon was mentioning, and very rightly, I mean, there is a lot of data, but how often has that data to be collected in order to be useful for health? I mean, that's something that we don't know. Those things have to be defined when we are defining those variables that can be captured from space. And there is a lot of science behind, and we cannot forget the science. And that's why Space and Global Health Network is so important for us. The demonstration to countries is very important. And that's something that, I mean, having the entities that we have around the table, quadripartite, we are talking about WHO, WOA, UNEP, and FAO, and the Office for Outer Space Affairs convening the space agencies on the other side. I think that's a powerful way of engaging countries and demonstrating to countries how things can be done. But first, we need to decide what to show to them. And that's why I think first the curriculum will be helpful because that can be implemented by universities and educational centers. But then giving them a suite of these are the things that you need to measure and these are the things that you can do with the measurements we are taking from space, is the next crucial step. So a lot of work in front of us. Thank you. I hope I answered.
I will pick on something you said earlier about the science policy interface. And this is something we struggle with also in the One Health approach, how to bring the science, because we have a lot of research done on the One Health approach, including on the economy of it and the return on investment. We know that it's very cost beneficial, very cost effective, but how to bring the research to the policymakers. And we are trying several options, including having scientists be part of the One Health platforms at national level. It's kind of cross-sectoral coordination mechanisms, and we advocate for including academia and scientists on board. So how you are going about it in the space agency and through your network with the health sector?
I didn't get the question.
So the question, it's not easy to bring science to policy. You mentioned one example for the high-level political forum. Is there any other examples at national level?
Okay. Yeah. So on the science to policy, that's why I mentioned the network, and that's why it has been so wonderful for us to have that network, because it's having those scientists, and the network has to report every year to COPOS, which are the member states, on the progress of the work they are doing. So for us, is helping the network to channel those inputs and put them in the format that the countries understand. And having that conversation, this conversation is happening in the Committee on the Peaceful Use of Outer Space, in the Scientific and Technical Subcommittee, enables countries to say, hey, I didn't hear about that before, I'm interested. And we had that this year when the preliminary work on the curriculum was presented, and there was a country that said, I want to be involved in the process. I want to be bringing my experts and discussing in that curriculum about human space flight and how human space flight can help health. For me, that's, for us, after it has been established, is the natural mechanism. I don't know which mechanisms you have to bring that to your countries, the countries that are members of WOA. But I would say that engaging with the Space and Global Health Network for us is easy because we can bring that to the countries that have the space capabilities, and they can think which space capabilities can contribute to it. I ask.
Please.
No, because I mean, we were discussing about the quadripartite, and there is a joint plan of action, and the joint plan of action was from 2022 2026. I'm interested in knowing more about how it's moving forward, because maybe there are opportunities.
Thank you so much for this question. As you rightly said, we developed together, the four organizations, this joint plan of action on One Health, which is kind of framework that give us the roadmap to work on 6 action tracks. Mainly the main threats at the interface between our sectors, starting from zoonotic and vector-borne, to AMR, to food safety, and the important issue of engaging the environment and involving them in One Health work. And also the first action track, it's cross-cutting about how to strengthen the system and to have the capable workforce to do the work. And then we developed an implementation guide to support countries take this framework, global framework, and turn it into national action plans or embed it into existing plans like the one for health security or for animal health. I see great potential that we can bring the Earth observation to our work. And for WUHA, we started this process through the two projects that Alessandro mentioned about vector-borne, anticipating vector-borne diseases by using Earth observation or satellite imaging, try to design ecoregions where those disease might happen. So prepare the countries to act before the outbreaks happens. Another domain that I can see great potential for the animal health could be monitoring the animal movement. You know that some of the movements across not just the region within the country, but also across the borders. And we cannot stop it, but we have to minimize the risk of this animal and to know where this movement is going. There's also potential for this plan. Now we are moving to the implementation phase and trying to support the countries to bring this your agency and ESA and other partner IZS and others to help us translate those concepts into concrete projects at national level. I hope you answered. Wonderful. And this plan, it will be continued like the first iteration. It was between 22 to 26, but we will have, of course, another iterations for it. And we look forward to our collaboration with you on the implementation.
I think another aspect of what we're discussing is if we can find particular instances where we're coming with a clear solution that is been a problem up until now. If we can find one or two cases like that where we can make a significant contribution easily, everybody can see it. That really is a very convincing basis for moving forward. I mean, just talking about the scaling inside policy. I mean, we weren't able to do anything useful in health, I don't think, until relatively recently with these sorts of capabilities. We were able to do some basic environmental analysis, and even getting the National Environment Protection Agencies to move to satellite data was difficult until we start really coming along with structural problems that they can't really be solved in any other ways, or we're making a critical mass of contribution that can change clearly for the better how the standard processes are going. So I think these are the sort of things I think that we should be trying to get started on as well, so that we can be very convincing, and everything else can follow from that. But if we can find some cases that everybody can understand, and again, we're critically dependent on working with the One Health guys for that, I think. So I think that would be what I would like to look at.
I can give you an example of concrete area where we can work together because we are struggling to quantify the drivers of disease emergence and spread. We know that land use change, deforestation, they have significant impact. But where they are happening, how much they are impacting on spillover, your agency can help us to understand it better and to find solution for it. This is just an example, but we are very open to more collaboration and discussion.
One question for, I would say, the three of you is about interoperability. We have heard it from Jorge at the beginning. This was something discussed also high level with the member states of the COPUOS. How do you see this? So, for example, on the ESA side for Gordon,
you have extensive experience with thematic exploitation platforms, with embedding satellite data layers into the platforms of the users. So there are different approaches. On your side, Chadia, you have VICE, the VICE system, which is, let's say, aggregating all the veterinary data, animal health data. And on your side, Jorge, you see the big picture. So how the different potential contributors, if they provide interoperability-based platforms, can work together. So the question is for the three of you. How do you see then interoperability in terms of challenges, but also in terms of opportunity for collaboration here? Thanks.
Yeah. It's a very difficult question, but I think it comes back to better. I think it comes back to what Gordon and Chadia were mentioning. I mean, we need data. We need data to make this thing much better. And to have those pilot cases that we were discussing before, we need data on both sides. And we need the science part. Then is the part of bringing that data to the policymakers. And that interoperability discussion, I mean, it's multi-layered. You can bring it directly to a Ministry of Health, and that's one type of interoperability. You can bring it to the hospitals, and that's another type of interoperability that is completely different. You can bring it to civil protection in case of disasters that are normally triggering also health emergencies, and that's a different type of interoperability. What we are looking at for the moment is the discussion with the ministries of health. And we don't have those connections. We have the connections with space agencies, and that's why, I mean, we were discussing with WHO to try to get those connections to the ministries of health. That's the first level of interoperability that we have to break through. Then that at national level can be implemented through policy, and that can be triggered down into how that data is going to be integrated and how the different data flows are going to work in order to have it in the different regional and then local systems. It's not easy because from what I have been looking at, and I'm on the space side, so I have limited experience with health. There is a lot of fragmentation in systems that are handling medical data, health data. And that would be a challenge. How to make a space in all those different standards that exist, and there are different standards, I would say, for this type of data. I think we are getting somehow there at high level, because this summer we had a very, very intense heat wave in Europe, and I could see a lot of health communication going on for population to say, well, you have to stay hydrated, you have to stay indoors, you have to stay on the shade. That's already a communication that comes from data, environmental data in this case, that is powered by space in many cases, to policy and to concrete actions to population. There is some notion of that happening, but we have to formalize it and to make it more concrete in policy. I don't know if that helped.
I mean, you've touched on a really critical element, this interoperability discussion. If you want to go and get a satellite image from ESA, you go to this site, okay? You get this list of file names. The file names are all really, really long. They're probably so long they don't fit on your screen. Okay, you have to scroll left or right to get just the file name. Okay, and they've got very similar names. The difference between if an atmospheric correction is applied or not, it's 3 little letters in the file name. Okay, these files are about 1 gigabyte each, more or less. Okay, so you think you've got the right one of the area you want for the date that you want. You download it. It takes several minutes to download. You think, oh, that wasn't the one I wanted the other one. I take also with your image analysis software as well. It's, you know, it can be quite heavy on your process. So that interoperability to get Earth observation use is absolutely critical, really. How do we do this? We have to make the whole thing on the Earth observation side much more banal. It has to be something you don't need to be worrying about all these file names. You want something, or I think with the health sector, we have to get to something that is a much simpler, customized product that contains the changes that the critical changes people are looking for, and all the other stuff. We all agree you don't have to worry about it, or people don't have to worry about it. We drop it. And people are quite happy in other sectors with other information that that's done. But we've got this culture in the Earth observation that absolutely everything is really critical. So we have to keep absolutely every little thing in there, and everybody has to be able to look at all of this all the way along. And I don't think that's really the case. So I think a lot of the discussions with the health community need to be, how do you make this stuff so banal that you know what you're getting, and it's that. And then how do we, not just with the banality, how do we technically make a particular complicated data set not just interoperable, but integrable in a structured way with very, very unstructured data sets. Public health data is inherently unstructured. Social media data, which we'll be using for, you know, seeing what's happening with outbreaks or whatever, it's inherently unstructured. So how do you put something that is technically unstructured with something with too much structure together into information products and analysis products that people from a multifaceted community can use in a sensible, useful, and sustainable way? So, you know, I don't have an immediate solution right now, but for us, it really is a priority focus is just taking all the difficulty out and looking at the essentials of what needs to be used and how these things are integrated. And I think the only way forward is really a much higher dependence on AI or machine learning type approaches. Already, we have so much, just the data that we have in the ESA Earth Observation Archive, we have so much data in there. There are not enough human eyes on the planet to look at the imagery we have in our archive since 2015. Okay, so we need artificial intelligence based approaches for doing that. And I think we need to be looking at more sophisticated, not just feature extraction AI, but much more sophisticated analytic and inference-based AI, combining these data as a key element of the banalization that I think we need to move forward on to get the a cost-effective and sufficiently focused methodology for giving the information that people actually want, when they want it, where they want it, at an affordable price.
Thank you very much. From our side, we are trying to harmonize the data between the 4 organizations of the quadripartite. And this effort started because of the COVID-19. It was a request from the G7 to understand how we work together, what kind of data we can share between animal health, human health, and the environment. So we did a study, we call it One Health Intelligence Scoping Study. And we identified these opportunities where we can harmonize the data between the sectors to be able to use it. If I get the data from the public health, I can use it. I can integrate it into my own system and use it. This is not the case currently. So we started by understanding what each organization has, what kind of data system and data you collect, and in which format. And then we understand how we can try to coordinate among each other. And the key recommendation of this study that we need to take an immediate action to build the system that talk to each other between those sectors. But unfortunately, we were not able to continue further because of the funding situation and because of interest. After the pandemic, the interest went down. So now we are back again to try to mobilize the resources and put it again at the political agenda. And hopefully we can get some traction soon. Thank you.
Question. So, no, because we discussed before about the joint action plan, and you were talking about the pillar one or the track one, right? That was about surveillance and about systems. How is that working? Because that could be a partial answer to this. So there is already a work in progress between the quadripartite. How that, is there any way to feed into that process with this data?
Yeah, exactly. This study was part of this effort before we developed the joint plan of action, and we integrated into the action track, so we will be able to continue working on it. But as I said, we need to develop some user cases to show the policymaker that it can happen and what would be the cost to make it happen. And then if we want to scale it up from the local to the national level, and maybe even regional, sharing information between the countries, how much this will cost, and the political will to do so should be there. Now we are just trying for the sector to share information within the country. And then hopefully we will also support sharing across countries. I think at this stage, maybe we open for, yeah. So now we open the floor for you to ask questions or provide us feedback and comments on what you heard from us. And we start with our colleague Keith Hamilton from WUHA, and then Shubha. We need the mic. Colleagues. So the people online and the streaming can hear. Here, Shubha. Shubha.
This one?
Yes.
Found it, thanks. Sorry, I could have gone and got it actually. I was just a bit confused. Yeah, I just really inspired by some of Gordon's remarks actually, and Charge, I should discuss with you before about kind of the scope of our collaboration, because when Gordon was talking about technology in the space sector, I was thinking about initiatives that we've been leading on the animal health side, which is to try and improve the sustainability of diagnostic laboratories. And we're trying to apply innovation to look for solutions. It's a solution. We haven't found solutions in our own sector. We've been plugging away at building laboratories that are too difficult and too expensive to run in low resource settings. So this year we've launched a grand challenge to look beyond our sector. But we found it very difficult to engage people in other sectors. We've had these dreams that maybe we'll get someone from the aeronautical industry to come forward with a solution, and even the space sector, because there are some common technologies used in laboratories, and I don't know, I presume there are also in the space sector. So the question was really, is transfer of technology, innovation, ideas, something that we could consider in our collaboration, or at least having a channel of communication so that when we have these ideas where we need an innovative solution, we could kind of have a channel to the space sector. They might say, no, there's no way, not a hope in hell that we could help you here. But there might be a slight chance that they might say, well, actually, we've been thinking about this problem for years, and we have these potential solutions. So it's just a question about scope of collaboration, and whether it's worth considering things like that, where the space sector might be able to help out with infrastructure and technology on the health side.
Yes, absolutely. I think the starting point for me would be the similarity in data science problems between a lot of information you're trying to extract from data in the medical or veterinary domain and the information we're trying to extract from satellite data. In a lot of cases, it's the same problems, just using different vocabulary. But in a lot of cases, we're using more or less the same processing, maybe not detailed algorithms, but definitely philosophies. And if you take that to its ultimate extreme, we normally steal all these, both from the medical side and the Earth observation side, from what the astronomers did 10 years ago, but they never have any money. So they're never able to do it. We've got computers and stuff. So I think, yes, absolutely. I think there's if we can find the right interactions, that is a very good basis for stimulating the collaboration. I think the other point you're making in terms of, you know, keep chipping away, trying to solve the problem with a particular methodology. I think the other benefit we can have from a cross-sectoral discussion is understanding what's the question we're trying to get an answer to. I'll give you an example of years ago we were doing a support to a NATO maritime surveillance activity, and we had a radar image where you see boats as little dots in black and white. And the American Navy, they were using very high resolution colored imagery. And there was an admiral from the American Navy said, ha, 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 you're trying to use this radar to see the ships. And ha, ha, you just see a little dot. And we see the whole ship and we know the shape of the bow. We've got a whole database in our big expensive computer on the shape of all the different bows, and we match that and the color of the superstructure and all of that. How can you get that information about the vessel from a really little dot? Without thinking that all of these vessels are transmitting on a system called the automatic identification system that has their name, their port of destination, their cargo. So you get like trying to extract all of that information from high resolution optical data when it's all there in a transponder message that the ship's broadcasting every few seconds. You don't need to do it. Okay, it's once if you're locked into a particular technology and that's or a particular approach and that's a solution. I think the multi-domain discussions is hopefully we can move past things that might be problems in one sector and then just putting things together realize, well, actually, you know, it's just a limitation of one particular approach. There's a wider set of approaches we can adopt that can bypass a lot of the things that have been holding us up for now. So hopefully that's something we can explore as well.
Just to follow up very quickly, could that extend beyond data as well? Could it extend to like engineering solutions as well? Because that's what we see with laboratories. A lot of the time it's engineering solutions. Laboratories are over-engineered for low to middle income settings and animal health research as well. Rosa was talking about, no, we were both joking about farming in space, but more seriously, we started looking and seeing that there's serious research that the egg race, the great USSR US egg race to have the first egg hatched in space, that kind of basic research and how that could inform animal health and veterinary medicine as well. So beyond the data, maybe there's other areas as well where we might consider collaborating.
We've got a lot. I mean, okay, we've got the Earth observation. I totally agree with your point. The other, I mean, there's a lot of other research going on as well. There's a whole program called Melissa that is used at looking at sort of biochemical or microbiological sustainability in the space, like on the space station. So how we can have reprocessing of waste products and things. So there's an awful lot of other stuff that can be brought into terrestrial situations if we've got the right context for doing that. And I mean, clearly that's something really high priority for us. So big yes on all dimensions you've identified.
How about now? Wow. Yes. Thank you. I would like to go back to a point. Still can't hear me? Is it okay? Can you hear me now? Okay. So it's a matter of how I hold it. Could I go back to a point that you made early on Jorge, that the dialogue between the environmental side of the One Health approach and the health sector is terribly weak. The dialogue with the doctors and the health officials, the government health departments, that communication is, I could say non-existent, but maybe it does exist, but it is very weak. That goes beyond whether we use interoperability or not. I mean, even before you get to that, we don't have a dialogue most of the time. And that also extends to the fact that we don't get the data that the health sector holds typically. WHO gives out some information, but at a very coarse resolution that does not match satellite observations. So it's very difficult to match the two. And why is that communication so difficult? To you or anyone else for that matter?
I mean, what I was saying is that Earth observation to health and vice versa is difficult. I mean, we are luckily here on the table and we have the right people. I think what you are saying is that health itself, the health community inside the country have difficulties in communicating. Did I get it right? Or
Perhaps
no.
I'm not communicating properly. What I meant was that the dialogue between, say, the earth science sector, the space sector, and the medical side is not very smooth or open or frequent. How do you convince them that there is value in using this information to reduce health risks? It doesn't happen all the time. Maybe to make myself a little clearer, let me use some example from my experiences and our experiences working in a small location in India. If we talk to the government agencies about the need for doing this, one of the questions we got asked is, so how will that bring in more money to the state? So you say, well, in principle, yes. In the longer term, better health should produce better economy. But you can't promise them that. So that failed. Then we went to another state and they want to find a solution to why leptospirosis is increasing. So we said, okay, give us the data and we will look at it. No, you have to promise us that you will be able to reduce the risk. So how can, as a scientist, how can I promise you that when I haven't seen the data? So I can't promise you. Then the data doesn't appear. The dialogue stops. These are just personal experiences. And I feel that when talking to others, that this kind of experience is shared. There's another question. The space sector has set a wonderful example of making all the data readily available, except for the commercial sector. It's a huge move, and it's a tremendous resource. You can't rely on a reciprocal agreement from the medical profession. To a large extent, that is determined by the need for confidentiality, all those things, agreed. But even after suitably anonymizing the data and making the patient's rights safe, you still don't get access to the data. So there are a lot of gaps in our communication and in our interactions. How can we best address that? I think it's more than it's not just money. Money in some of the examples I mentioned, but it's not only that, I think.
Shubhaya? Dear Shubhaya,
Yeah, I will start and then Stefano as well. I think each sector should feel that they will benefit from this collaboration and it will get easier down the road. The start is difficult because we didn't use to work together, and we don't know what do they have, how we can use it, and it seems all challenges at the beginning. But the more we work together, the more our understanding will increase, and then it will be easier to do it. And also the cost, the human cost and the financial cost, the money that William said. But also it's a human cost because you need the staff to work on it and to clean the data and to make it usable for other sectors. So this is an extra work that will come to them, and they need to factor it in their work plan. From the experience that we have from the environment sector so far, we are trying to integrate it more and more into the One Health space, but it's not easy, always easy, because of the reason that I shared with you. But I think with time and efforts, it will become more not the norm what it should be. Like we have to work together, all of us. But for now, it's step by step. Stefano?
I think part of the answer to that question is what we have seen here. When I was asking the question, how many doctors are and how many practitioners from Earth observation, I mean, you see the big gap and the big division, and that, I mean, Stefano has experienced it. We have experienced it when we have organized conferences. We have to get to that 50-50 because otherwise, I mean, there is a lack of communication. I think capacity building is very important. And I think that multidisciplinary curriculum that I was mentioning before, space and global health, can help building up that understanding in the medical community and also in the Earth observation community of which are the constraints and the benefits of working together. I think that's key, but that will take time. And it's not something that it will happen overnight. We have to be working about it. And having this meeting here with the right actors around the table, I think it's a good starting point, but we have to continue working.
Now, I can make a couple of points on this. I think the how R&D actions are funded is inherently sectorial. So it's very, very difficult to build cross-disciplinary teams in applying one capability to another sector when most of the funds are associated with a particular sector. What you end up with is a consortium of all the usual suspects plus one little person from the other sector that's in there so that they can get the money. I mean, that's an extreme case, but I mean, that's, well, I mean, that's problematic for a lot of sectors. We need to be much more aggressively cross-sectoral in the funding. I mean, we have problems with our fund, with some of our member states saying, what are you doing over here? You should be do the core Earth observation. What are you doing taking Earth observation to these other sectors and having people that aren't space companies being paid by a space agency? I mean, we have problems with some of our member states doing that. So I think unless we can get a critical mass of collaboration in the development projects coming from both sides, we're going to be having a lot of conferences like this going forward saying, well, you know, we don't know you, you don't know us, whatever. So I think that's absolutely fundamental. And I think if we can think about what in a lot of projects, you know, I mean, there's a pathway in Europe. If we can start something in ESA, then the Commission can come, the European Commission can come along with more money, bigger projects, more partners, and we can start making the links through using everybody's funding sources in the right way. But I mean, it needs everybody to take the risk of being cross-sectoral and not being anchored almost exclusively with inside their own comfort zone. And it takes, you have to argue, you have to be prepared to argue a lot to do it. We'll do it. We will make these arguments. We think it's worthwhile, but we need the community that is getting the money needs to understand the benefits of this as well and say, okay, yes, we will. Not all the money's for us. Some of it is for these other people too, and we can benefit by getting the money from the other sectors. Okay, so it's not zero sum. It's not losing out. But that we need to get around that, I think, and there's a cultural element in who's going for the R&D projects, how to think about that.
Can I make an extra
I would
point? Or is it moved on? Sorry, did you want to speak first?
Thank you. Dear Shuba, I wanted to refer to your question. Wonderful to see you. Esteemed colleagues of the discussion panel. While I cannot, I'm a medical doctor by profession, while I cannot answer your question regarding data privacy and the communication challenges in the specific case that you mentioned, I would like to say that while existing networks such as the Space and Global Health Network already facilitate important interdisciplinary dialogue and capacity building, I believe that establishing or partnering with a specialized science policy interface could help overcome these barriers, meaning such as siloed professional networks, funding challenges in different languages or timeframes that we all work in, because those are part of the problems that you mentioned. I've been thinking about a platform called a Geneva Science Policy Interface, which is based in Switzerland, and it's, I think, one of the first of its kind. And they play a crucial role in facilitating and fostering dialogue and building capacity, because they're also brokering collaboration, especially between all these silos and highly specialized professionals, between scientists and policymakers, and these different sectors, as mentioned. And they are also looking especially into advancing human rights, environmental health, into global health and medical sectors. So I'm happy to connect you to, or connect also the UNOSA network and the Space and Global Health Network and other stakeholders here in the room with the GSPI, if you're willing to look into this. Sorry, I would like to add, they also have a specialized program called Boundary Program, which is training the role of boundary spanners. And this is a term for professionals that are, on one hand, in depth in their own roles, but they understand the collaboration between different sectors.
So Shuba, let's try to wrap up. I mean, it's your question. It's a wide question, and we have done some things together with you. I have here in front of me a roadmap of the things we have done in the last 7 years. There are many actions that have been taken. I would say the first one has been delivering trainings. I mean, normally we can see 150 attendees on the training on waterborne diseases that we organized with your team and many partners, including the Commission and different agencies. We had more than 600. This means that if things are done properly, there can be their uptake, and of course learning about the capabilities of Earth observation. What can Earth observation do for veterinaries and medical doctors and public health specialists is the first step. The second step is not only convening user forum. This is a user forum, so all users are here, potential users of Earth observation data are here to discuss their needs, and we can try to design programs in order to respond to this. But the other thing is that it's for us to be ambassadors for you as well. I mean, you are one of the lead scientists in the world on ocean color. So attending conferences or participating in activities outreach activities of the medical communities and the veterinary communities is also of essence. We will have on Wednesday morning Professor Münzel from the European Society of Cardiology. That's a very good example. We have a couple of contracts where we analyze the risk factors related to heat waves that have been correlated to emergencies in larger cities. So this is something where, let's say, we can also be active. I can say in the last 5 years, at least in 3 occasions, when we attended gatherings of doctors or these communities, many times they were not aware of what actually Earth observation can do for them. So this is also an important step. Concerning the funding, I would say also on EO industry, we have here also the representative of the European Association of Remote Sensing Companies. It's important that European companies dealing with Earth observation, they can see also a business case, or they can see a business into this. So it can become commercial. We will discuss also this. I mean, there is a very good example in Finland we were just mentioning before, where you have a commercial new space company dealing with hyperspectral. ESA has been supporting them for the manufacturing of the second satellite, and they've been partnering with the environmental protection agency, the EPA of Finland, for monitoring the water quality, linking it to harmful algae bloom, for example, with very innovative hyperspectral sensors, which are not available today. So there you see that there is already a partnership between the public and the private, where the private is, in fact, the private industry, in the space industry. So that's also something that needs to be accounted. And we have later on now the dialogue between Nova Space and ESA, especially on also looking at these new opportunities in the European landscape. So there are different facets. I think we are moving in the right direction thanks to all the participants here. We are now addressing a new community, a bit new community for us, which is the veterinary community together with WA. This is also already a first step to be here at the premises of WA and being able to discuss with the vets actually their needs and how we can provide valuable data for them to improve their modeling and their response to health threat. Thanks.
Can I add some more to this discussion? So just from, again, if you talk to doctors on a one-to-one basis, you come across doctors in your life, you are very right. Many of them will say, we didn't know anything about this. So it's not part of their curriculum. They have no idea. Then they say, but we would like to be involved, because the idea of looking after the environment and human health at the same time, that's very appealing. So we need to somehow give them a chance to do what they really want to do. So the other point I want to make is that even in the UK, where I live now, I was sort of shocked to see how much of patient information lie around in FAT files. They are not digitized. They are not accessible beyond the doctor and the patient. So eventually that information will be just lost. Never mind interoperability, we don't have the information in a digital format that can actually be used. So it's a lot of information is just getting lost because we don't appreciate the value of it. But I understand that this is the meeting to try and address many of those things, so I mention it. And the steps that we make, Stefano, they are important, but I still feel they are very small. They need to be scaled up. Sorry, thank you.
The last comment.
Yeah, no, I just wanted to comment because there was several times people said like, oh, we need to make the health sector more understand what we're doing. That's exactly what we've been doing for the last 10 years. And it's not that they don't understand what they do, but it's also we're being blocked by higher political levels. Like on the commission level, that health data is not allowed to be shared anymore, and it's getting actually worse instead of getting better. And I've been working on the integration of EO data with health data and models, etc. But without having access to both, there is no end product. And so it's not just a question of making or helping them understand what we do. A lot of them already do understand what they do, and they do see the benefit of the added value. But it's there needs to be on a higher level. And I don't know, I don't think ECDC is here, for example, but they would be a very valuable actor in this discussion, because they gather health data in Europe and are in a position, or should be in a position, to then share it with the researchers in those multidisciplinary research project that several of us do on a daily basis. So it's not a question of understanding. In some cases it is, but in a lot of cases it is not just understanding.
Exactly. Yeah, thank you so much for highlighting this important issue of governance and institutional arrangements to share the data. Because if you don't have clearance, you will not be able to share it. But to have clearance, you need to have the political will and the approval from highest level that, yes, we are in to share our data and to use Earth observation data for our interventions. So I will stop here because we are running late on the program, like 10 minutes, it's okay. But now this gives us also the opportunity to build on the last comment about the European landscape. So we will have a kind of a dialogue on Earth observation and health in the European landscape, which Gordon will co-chair with our colleague from Nova Space. So I would like to thank the panelists. Thank you so much for your interventions, for your ideas and wisdom that you shared with us. And I'm sure during the following days, we will have more on this. Thank you so much. So over to you, Gordon, for the next panel.
Okay, so thank you very much. So we've got quite a short session now. So we've got Anne-Catherine from Nova Space, who would, rather than sort of do a presentation, I've even got a bio here. So Anne-Catherine was a young graduate trainee with ESA. It says here more than 10 years ago. So worked also on the application side of things in Norway with Kongsberg, and has been working as a consultant for quite a long time as well with Stefan Urovic and then Nova Space. So Nova Space have been doing a body of work that we thought was of relevance for the discussion, and it didn't fit completely in any of the panels, so we thought we'd deal with it as a separate discussion item, if that's okay. So I think to start with, if you could just introduce yourself and just give us a high-level summary of the work that you've done, and then we'll drill into some of the more detailed points for of higher interest for the people here.
Good. Thank you so much for the invite. Yeah, so what I'm going to do is give a bit of a industry perspective, not necessarily the Earth observation industry, but really the healthcare industry. So yeah, my background is in Earth observation. Actually, my master thesis was about the influence of environmental parameters on the spread of bubonic plague. So I started with the interaction between Earth observation and healthcare 15 years ago, and then only recently got back into it. So what we've been doing with Nova Space is working together with the EU Agency for the Space Program, EUSPA, which is different from ESA, where they're focusing more on engaging with end users, commercial end users, to increase the user uptake of Earth observation, and then in particular Copernicus, which is the European Union's free and open Earth observation program. And so we've been working together in the past few years with large pharmaceutical companies, but also with medtech companies, on helping them to integrate Earth observation data and seeing how that can improve their processes, how it can give them an edge. I think one example that we've done, for example, was a pharmaceutical company that focused on respiratory diseases, asthma, had a puffer, and was digitalizing it. So one of the things that they wanted to integrate was environmental aspects like air pollution, to see whether patients, or to give warnings to patients, so that when air pollution was worse, they would need to use the puffer more often. What we did for them was, so it's very typical, I find, for the pharmaceutical industries. First, you do a research study to understand what is the correlation between air pollution and how often our patients use these puffers. And we did it in particular for wildfires in Canada. So understanding when there's wildfires, around which locations or how far away does that impact our patients. And so that was something that in the end was integrated. And there's other examples I can give, but one point that I was hearing here as well is that it should be easier to use these data. And what we found, so we used data from the Copernicus Atmosphere Monitoring Service, which is already derived information. It's not the satellite images themselves. And we help them with understanding what is the exact parameter for air pollution that is relevant to you. But then they use their IT team, but for them it's then just data from which they extract statistics. And so it's the pharmaceutical company, the IT department themselves, that then implemented everything. So I think there is improvement in how these Earth observation data are useful to non-space users as well.
Thank you. Just so that we've got as wide an understanding of possible. I mean, you talked about the air pollution and respiratory disease. What other sort of environmental sectors and health connections have you? Can you give us sort of 4 or 5 of the things so we can have as broad a view as possible?
Another one that we did was with IQVIA. They're a healthcare software company, and they looked into how if they could use forecasts of pollen data, again from the Copernicus Atmosphere Monitoring Service, to see if they could better estimate the distribution of allergy medication. And that was specifically for the Czech Republic, but they also wanted to see whether they could scale it up so that you could, know that whether a specific area, you will have an increased demand for allergy medication. We worked with a medtech company that focused on coughing. They had a software for monitoring coughs of patients, and then help them understand as well how do air pollution, so particulate matter, pollen, how does that influence or how is that correlated with coughs in which location? So then we were really working at a very local level, so patient room, waiting area. One thing was actually just mentioned is how do heat waves impact people's health? And in particular, so we had one study where we wanted to look into the impact of heat waves on intracranial hemorrhaging, then got into the whole problem, like we couldn't get the patient data on the intracranial hemorrhaging. But then the company that we worked with got some other data on cardiovascular events, which was then also of interest for insurance companies who want to see, like, okay, if we can forecast whether there's a heat wave, and in hospitals the staffing can be adjusted, or there's operations that can be moved to better moments. Do we then have fewer deaths, fewer complications, and so marginal improvements of the costs that are related to it? And then one example is not related to the direct environmental impact of things, but it's pharmaceutical companies, you do clinical trials at a global level. And one company spoke to us and said, yeah, one problem we had when the war in Ukraine broke out is we had a clinical trial going on there. It's very important that it's monitored closely. The patients get their medication at the right times in the right settings. But they lost track of their patients when that war broke out, and they needed to be able to contact them as quickly as possible. And the only way that they could do it at that time was to put a phone number on our website and say, please text us. So one of the things we were trying to help them work out is, like, how can we help you determine what the risk is? It doesn't have to be a war, but flooding, so that like, if I have patients in that area, I know, and I can respond much quicker and help them out and make sure, whether it's a clinical trial or whether it's medication provision, that keeps on going.
Okay. In the context of the discussion we were just having in terms of the understanding and awareness between sectors, you've been working with a number of pharma tech companies. What was the starting point of these discussions? Was it, we've got a problem, what can you bring to do it? Or are you going in with, we've got this information, how do you think you can use it? Or is it something else? Because, I mean, you've started a lot of conversations that we're just having discussion, how do we start these? So if you just give us some comments there.
So it was a bit of a mix of both. It was both, we as taxpayers in Europe put a lot of money into Copernicus, and the European Commission needs to show that this actually benefits our economy. So then USPA has the mission to also go and push the user uptake. But what we did very specifically when they said, like, okay, we want to see whether we can get into the healthcare industry, is we had so for the first few months, we had very in-depth conversations with several pharmaceutical companies, medtech companies, about how do you work, where, what are your business processes, where are your where are your challenges? Because I think that's most important. We can't go and say, like, okay, I think this would be really great and that would be really great. We really worked from first understanding their needs, and they weren't like what we thought in the beginning would be potentially a use, an interesting use case, was not always interesting down the line. But then other things came up. Yeah.
Okay. And in terms of the health issues, was the interest primarily on existing disease, existing health situations, or is there also any thinking about emerging threats, emerging diseases? Where would you position the work there?
No, it was definitely more on existing. I think one thing that we really noticed quickly is that, and I heard an interesting comment earlier about it today, is that when they're looking at emerging diseases, the focus was very much on yeah, what do you call it? Like really working at a molecular level, gene technology. But I heard that there's also someone here in the room who's working on epigenetics, which is how then the environmental factors influence those gene yeah, activation. So that's something that we didn't hear at the time, but I guess then already also goes a step beyond on how environmental factors can also help with new medicine development.
And okay, to me that's one area. It takes me on to my next question. Were there priority information gaps that these, like some of these companies are saying, it would be really great if we had the following thing, because that's really holding us up in this particular situation? Did you encounter that, or was it some other driver? If so, what were the other drivers that we can then leverage and build links on?
I think the main thing was really this the fact that people didn't know that there was so much environmental data out there that was free. And I think that's also an important thing with healthcare. Because you don't improve or you don't reduce the cost that much, or you don't generate that much more revenue, it's very important that these data are freely available, because then it becomes interesting enough for them to put some resources into it and to start looking at it. Expensive data, which would also be interesting to look at, like a high resolution data, for example. I don't think that that's reasonable for them to expect that they will then actually be interested in integrating that into their processes.
Okay, and in terms of the again the cross-sectoral aspect, I mean, you're coming along with data sets that these guys are not used to handling. Did you have to do any effort linked to the trustability or the credibility of the information, or did they say, oh, great, particulate matter, PM10 or PM2.5, brilliant, and they just believed that it was what you said it was? What was the interaction there?
Yeah, so that was really important, and I think we have the real benefit that with Copernicus we do have reliable data sets. There's a lot of information already available on, okay, these are the studies that we've done to understand whether like how reliable or how accurate these data sets are. So, and then we use also experts to make sure that they fully understood what are the data, what is the accuracy, what can I expect, what should I not expect. Yeah.
Okay, and you mentioned when you're dealing with these people, you have to look at, or these organizations, you're looking at, detailed elaborations of business processes and things. Having gone through that and established first contact with a lot of these companies, what would your suggestions be for how we, as an Earth observation community, can interact better with the sort of the tech side of the health sector? And maybe also, is there opportunity for that interaction to come in the other direction as well, based on what you've seen?
I think that I think it's important to find the right actors. It was mentioned earlier, like, oh, doctors don't know that these data are out there, but perhaps they don't necessarily need to know. They need to have the right information for them to be able to treat people. But perhaps it's the people who provide them the data, a software company, a medtech company, an insurance company that put some processes in place. Perhaps it's them that need to integrate those data, and the doctors, in a way, shouldn't care whether this comes from where this comes from. So I think that's important. And then the second part of the question.
So how can we encourage a conversation coming from the other direction as well, from pharma to us?
Yeah, good question. I don't know. I think that's a difficult thing, right? As long if you, I think there's what Earth observation often offers is the ability to better prevent diseases or emergencies. But and that was also mentioned, like the budget for prevention is usually very small compared to the budget of treatment. And so if prevention, even at a larger scale, isn't seen as something that's urgent, that's something that needs to be invested in now, then you won't get that pull from the pharma companies to say like, okay, let's do prevention. But on the other hand, what you can do is keep on increasing that awareness and making sure that there's there's for example the Copernicus Health Hub, where you can find use cases. There's work that you're doing on generating that awareness about what Earth observation or can do to support the healthcare industry. And then the people who are interested in it will then have the ability to find that information.
Okay, I think I'd just like to highlight 2 points you've made there. I think in the first part of the answer, you're pointing out there's a number of different technology sectors looking for an interaction with health. So like you mentioned IT and insurance, also probably logistics for ensuring like vaccine transport happens safely, etc. So there's a lot of people trying to crack the same nut. Are these people interacting in the right way to be doing that and making use of synergies between the different external non-core health people? And if that's not the case, what should we be doing about it? And the second point, I'll open it up to the audience after you've answered that one.
I would assume not, but also because probably like logistics and IT of a pharma company and insurance, in a way, even though they're part of the healthcare sector, they're if you look at the space sector, for example, like we have downstream people here, we don't have someone building the satellites here, and there's not always a direct communication, even though you're in the same sector. I think one thing that I find a very interesting evolution, and I think might really help with general user uptake, and that's not exactly an answer to your question, but is these large language models, and that an end user can just ask a question, and if it's I think there is even Ask Copernicus, a beta version at the moment, so that they can ask a question and get a scientifically robust answer, and they don't have to ever deal with a satellite image itself.
So again, just making it easy. Does anybody in the room have questions on this, or are we running out of time? No. Okay, you're all scared into submission by the chairs. Okay, so so thank you, Anne-Catherine, for a very interesting discussion, and I hand back to the chairs.
Yeah, thank you so much. We can still have a discussion during the coffee break, which will start now until 5 p.m. And it's by the reception area when you first enter the building, to your left, the room there. So please go and have some rest, have some conversations, and then we see you here at 5. Thank you. You can start. Yeah.
Welcome back, everyone. So we'll start with the next session. I present Marius Gilbert. He's a professor and vice rector of research and valorization and vice rector of culture and scientific mediation at the University Libre de Bruxelles. He started his research career as a visiting researcher at the University of Oxford, where he obtained a PhD on spatial epidemiology of a forest insect pest at UBL. During the COVID pandemic, he joined the expert group assembled by the Prime Minister, Sophie Wilmes, to advise the government, and he was also at the forefront of the expert communication in the media. Welcome, Marius. Looking forward to your talk.
Thank you very much. So I've been trying to address the concept of health resilience from my own experience in the pandemic, because I think there's quite a lot to learn. So you won't hear a lot about remote sensing, but you will hear probably a lot about interface between science and society and communication, because a lot of that was at stake during the pandemic. So before I get into the content, I'd just like to highlight what has been my trajectory. Primarily, I was, and I say I was because for my responsibility in my university, I don't really do research anymore myself. But I was a researcher, so my first role in the pandemic was to address some of important questions, and I was chatting with Moritz Kramer because I will remember the time when we thought Africa was the main thing when it was starting in China, because they had such a low hospital capacity, and the reality turned out to be slightly different. But also starting to think when we entered into the lockdown, what would be lockdown exit strategies. And then I joined the expert group that was assembled by the Prime Minister to try to get out of this lockdown situation. And I was involved into decision making through at different stages, also through several hearings at the Belgian Parliament. And I was also heavily involved into the communication with the public during the lockdown. That for some period of time, I was daily on national TV, having regular interventions during the second wave, and then I tried to convey what the kind of learning I could assemble from that experience into a book for the general public. And nowadays, I'm now a columnist for Le Soir, which is a national newspaper where I address questions at the interface between science and society. I'm vice rector of research and valorization in my university. And I'm also involved in a number of policy fora at the federal and regional level in Belgium. Now, just to put the timeline of how the COVID pandemic struck Belgium, there was 3 distinct phases. And as you can, and here you have the number of deaths in Belgium blue, and the average of the European Union is 27. So it's not rocket science to see that we had a very harsh first wave compared to the rest of the EU, a really harsh second wave, and then we did slightly better thereafter. So the first wave, and that's something I'd like to highlight because I think it's a very important lesson, is that when COVID struck Belgium, there was, as in many countries, a very strong vulnerability. And this vulnerability had 2 different dimensions. The first dimension that is often mentioned is, we talk about masks, you could talk about protective equipment, you talk about diagnosis capacity, there is all those elements of procedure into the health systems that were not enough in place. There's been talks about ICU capacity. This is all what I call the material components of vulnerability. And then there's another set of parameters that are also equally important, and we found it the hard way, which I call the societal component vulnerability. And those are for Belgium, that we are a very dense and connected country with a high fraction of our population who is above 65 years old, and including a significant fraction with lots of comorbidities, lots of elderly people living in care homes, and importantly, a low culture of infectious disease prevention, in scientific culture in general, and not only in general in the public, and I'll get back to that, but also in journalists and decision makers. and also the presence, and that's not unique to Belgium, of anti-science, anti-vax, and populism movements. So of course, when you combine all those conditions, that explains to a large extent the first wave. So we went through the first wave, we went through the lockdown, we managed to curb down the epidemic, and then there was a little bump in the summer, and then the autumn was coming. And I remember very well when the autumn was coming, and that myself, epidemiologist, we had extremely good models showing and demonstrating that the autumn and winter wave would be absolutely dramatic. But that's when we fell into the communication. We lost the communication battle. So although we had excellent and very accurate model at the time, there was a number of extremely strong dissident voices in the media. And here is, if you read French, this is one of my colleagues saying, it's incredible that an epidemiologist say something like that. And he was speaking that about one of my statements, saying that, you know, having an R node of 2 at the time was a worrying evolution. And also, media themselves played quite fire with putting one expert against the other on science communication. And there were, you know, you had one epidemiologist, myself on the one hand, and another one, someone who works in ICU, who say, yeah, I don't truly agree with how this entire pandemic is managed. And of course, the one who is in the hospital wins the communication battle. So we lost the communication battle, not only with some of our colleagues, but we also lost it with many of our politicians who was requesting that we should treat COVID as you treat road safety, essentially, that there is no zero risk, but if you treat COVID like road safety, you're forgetting a very important element of contagious diseases, that they are contagious. So we tried to convince them that you should treat them as you treat forest fire, but somehow it didn't work out. So many policymakers played on the public fatigue. We were in the middle of what I call the prevention paradox. So when prevention works, and that was the situation in which we were during the summer, it seems useless, and people start saying that it should be lifted and measures should be lifted. And there was a profound misunderstanding of the nature of an epidemic. So this brings me to one event that I think, being in Paris, I cannot refrain myself from saying this, which was, we were at that time, here. We were really close to the peak of the second wave. Our hospitals were almost full. I was about to speak on TV, and then I realized I was not speaking to the right people. So the next day, I decided to make a call to the influencer on Twitter, asking them, if you read French, you who have 10,000, 100,000 followers on Facebook, Instagram, help us to communicate about the situation in which we are now. And this went really, really well. So it showed the power of social network when you use them appropriately. So it was retweeted by several Belgian celebrities, but it was also not retweeted in the same way by Emmanuel Macron, who 4 hours later made another tweet saying, if you have 50, 100, or 1 million followers on your social networks, you could help us. So I have the pleasure to have been copied by President Macron's communication team. But not only on the first tweet, but the entire thread was, you know, a copy of, almost tweet by tweet copy of mine, including I was saying that help us to say that maybe the mask is the equivalent of condoms, but of course his communication team could not use the same analogy. He said, help us saying that the mask is like the safety belt in a car. Anyway, so that's just for the anecdote. But eventually it shows the importance of communication. And then we come to this third phase of how Belgium handled the pandemic. And as you can see here, we didn't handle it too badly. And that's when vaccination came. So we won the vaccination rollout battle. We had excellent logistics. Things were implemented quite fast. The people took it relatively effectively, and the communication wasn't too bad around the vaccination. And I think, and for our country, it was really, really the end of the pandemic, because even if there were a few bumps, they never went to the kind of level we had known during the first 2 waves. Now, my talk here is not about the pandemic itself, but about learning. What can we learn from those events? So I'd like to summarize a few learnings. The first learning is that in terms of communications, the challenges of communicating are identical for the general public, the journalists, and policymakers. We should never assume that policymakers are in any way smarter or more familiar with science as the general public is. And we should not assume that the journalists are in any way better. For most of the people you speak to, the last time they've heard about science seriously was during secondary school, unless they have a specific interest for science. So this is really something that is important, and I'll come back to it perhaps in the discussion, because even in the way they establish truth between themselves is different than the way we do in science, and we have to understand those barriers to efficient communication. The quality of science communication becomes absolutely central in those circumstances. And it becomes absolutely key to be transparent about what is known, but also what is unknown, the changes and evolution of the knowledge, the possible link of interest, and also to use third-party independent data sets that everyone can access to. And maybe we'll get to that in the discussion about the use of remote sensing data. And at all costs, avoid arguments of authority because they simply don't work. If you try saying, I'm right because I'm an expert, it doesn't work. What you should do is to explain things in intelligible terms or why you are making a specific recommendation, trying to get people on board with you. And one thing that I realized, which is what was quite a surprise to me, is that because we're scientists, we think if we want to convince people, we should use numbers, we should use figures, we should use graphs. They're less powerful than metaphors. Once people got the point that this pandemic had to be managed like a forest fire, it became absolutely clear that you don't wait until half of the forest is burning before you send the airplanes, that you have to work on that early on. Another example I was using a few times, someone calling in saying, I'm working in a lab. Lately, we're seeing much fewer positives. And I don't understand why people are saying that the pandemic is starting again. So that's just an abusive generalization, right? If you talk in that term, no one will understand. But if you say that, okay, I've never been burglared myself, but I'm not using that argument to say that there's no thieves in my city, people immediately understand what is abusive generalization. So we have to use metaphors, and we have to stop thinking that numbers as the best way to convince people. It's a very important thing to keep in mind, especially but not only to the general public, also with policymakers. A very hard realization was that as scientists, we think that models are important. Of course, they are important for us to give good advices, but policymakers most of the time, and all the public too, they don't trust models. They trust the reality. They only started to get worried about the pandemic where they were seeing the actual numbers of the hospitals getting full. They never acted effectively when we were making predictions that the hospitals would get full. It's a hard realization, so we have to find ways by which we can try to improve on that, but it is something that we have to be aware of. But I'd like to follow up with a very much more positive learning, that is that strong and decisive actions are possible when there is a clear alignment between scientists, decision makers, and the society. And when I'm thinking what I describe here as a strong and decisive action, it's the lockdown. Who would have thought that entire society would stop to protect the most vulnerable parts of society? So I'd like to, if you take this beyond COVID, the pandemic implies a deep transformation of our norms, changes in behavior, but those were always meant to be temporary. And of course, we knew that there would be technical solutions within reach. If you think longer term and bigger challenges such as climate change, they also involve deep transformation of our social and economic norms, changes in behavior, but they're not temporary. They're long-term, but they involve long-term solutions. Now, if we want to address them, we need to clearly align three different axes, three different poles: the governance, society, citizenship, and the world of expertise. Because the world of expertise and science is at the heart of many challenges that we are having in the future. When there is a crisis of trust between expertise and governance, you have Trumpism, and we are seeing this damage of Trumpism is making to science in the now as we speak, and it will have a very tremendous impact on the future of the US. When you have a problem of trust between the public and governance, you are seeing the rise of populism. And then when there is a crisis of trust between citizenship and science and expert, you have the rise of all conspiracy theories. And when you have all three, it becomes almost impossible to address any complex societal challenge. It's just a no-go. So as with university, as researchers, we need to try to animate this relationship. We have to be better at science communication. We have to get people to understand better how science works and what is its added value in terms of way to understand the world and make actions that have predictable effects on the world. And that's absolutely essential. I'm going to skip that. Another learning is that social vulnerability matters as much as material and technological preparedness or solution. And this is a very important realization. There's been a number of papers after the pandemic that showed that the resilience of a number of countries correlated to levels of trust, that there was also very strong association within countries and between countries, between the impact of the pandemic and inequalities. And yet those traits that characterize societies as they are not always part of pandemic preparedness. You know, there was this very strong statement of Richard Horton in one of the Lancet editorial saying, okay, COVID thrived on inequality, and we don't make this part of our discussion about the future of health. So we should, and of pandemic preparedness, we should make this more at the core. So I'd like to end this talk with a bit of a reflection on how the concept of santé commune, it's out of a notion that was introduced by Michel Serres. Michel Serres is a French philosopher, and he was starting from the definition of health, and we can start from the definition of health of WHO, which is a state of physical, mental, and social well-being. Now, we can quite see from those different examples that the health of individuals rests on the health of the society in which they live, work, interact. So we can characterize the health of an entire society. And the health of a society is not only the health of the individuals that compose this society, there are also some traits that characterize the society itself that are important for health. And those traits can be poverty, inequality, social cohesion, level of trust, education levels, freedom of speech. Those are all very important traits of societies that would help favor healthy people within those societies. The pandemic has demonstrated it incredibly strongly, and this is something that is very important. And of course, you cannot have a healthy society in a completely destroyed or damaged environment. So there is also this notion of healthy environments, healthy individuals living in a healthy society, living in a healthy environment. And this approach tells us that we should also be concerned about the state of ecosystems because those rest on each other. So I like to think this model as something that is very complementary to the One Health approach, because the One Health approach that is often mentioned in different forums is very important in the way it connects human health, animal health, and environmental health. But what I have always missed into that representation is the social dimension, that we are all in societies. And this has made One Health something, sometimes it's a fantastic framework to operationalize in food safety, in zoonosis, in virology, in neglected tropical disease, in AMR. It's very, very powerful in those specific domains. But once you have a pandemic, how does One Health help you? Once it's there, it helps you to understand the origin. It helps you sometimes to understand some potential animal reservoir, but it's not going to help you to understand how it spread and how to prevent the spread. So I think we need to think of those different models as complementary models that speak to each other and that also have this in common, that you need to connect, that they are intersectorial, that they connect human collective health, animal and environmental health, and that you could work toward better prevention and action that you can take at the different levels. And I think that this is something that on which I will echo during the discussion when we get on how we can connect that to Earth observation and prevention and different kind of modeling that can be done. And with this, I will close this presentation. Thank you.
Thank you so much, Maurice. It's very informative presentation. And I like the last part when you talked about the societal dimensions of One Health, which we should address in our work. And you are right, we start with the prevention, where the animal health has a major role to play. And then we work towards preparedness to respond. Also, animal health has a lot to do there, especially with the lab diagnostics and other infrastructures. And then when it's spread between humans, it's mostly the public health that should lead the efforts. But of course, we support in all of this. So to discuss this more about the health resilience, I will call now on our colleagues, William Wendt from University of Oxford, and Gordon again to co-chair the next session and to introduce their speakers, including Maurice, so you can expand more on those issues. Thank you.
What a trigger from
Yeah, we have
vaccine rollout.
We have an entire project on it.
Oh, yeah?
Yeah. From my
No, but
budget.
your specific tweets.
Oh, that one, no.
Like you can, you know, do like intervention day X when you and then how rates of vaccinations have been changed.
But that was.
Do you want to answer questions now?
No, let's move to the discussion. It's been announced. Yeah.
Great. We like it. No, because that's what usually.
Okay, hello all. Firstly, thank you very much to Marius. I found it fascinating, and I'm sure some of his topics will come up in the next hour or so. They're written down here, so with a bit of luck, they will. There's a load of us here who are now tasked with discussing health resilience. Now, I don't know about you, but as an entomologist, I actually had to look up what health resilience was, and then reinterpret it in terms that a lowly ecologist can actually understand. And I realize it's actually very much like ecological resilience. In other words, it's resistance to perturbation, so a bit like a pendulum. How hard do you have to push to get it out of balance in the wrong way in terms of health? And then how quickly does it come back again to the normal state of affairs? So that's what I understand health resilience, but it can happen in a number of different contexts. We have the epidemic context, which we sort of talked about a bit already with Marius, in relation to insecurity and how insecurity affects health. In relation to economic change, you know, when we all get poorer, things get worse, as we know. I mean, certainly in the UK, you can see what happens to the national health system when there's no money. Natural disasters is another one. Climate and environmental change, and then institutional or regime change, which is again something that Marius mentioned with the glorious Mr. Trump. So there's a number of different ways resilience, a number of different contexts rather, in which resilience can be seen and can be interpreted. And that we've got people here who I think know enough about all those different circumstances to be able to contribute. One of my very firm instructions from our glorious leaders here was to make sure that we bear in mind at all times that this meeting is about what ESA can do to help the situation. So it's not about us just saying, okay, hi, there we go, let's talk about resilience. It's what can ESA do to help us address problems that arise from health resilience and otherwise. So I have a list here just so that you have the context. We know, well, most of us, I think, know there are a number of different satellites helpfully labeled 1, 2, and 3, so that's always good. All of those, anything that comes from any of them is of interest. We have various thematic approaches. The monitoring using Earth observation. Basically, there's a very long global monitoring for environment and security, which has a nice acronym, but it's essentially the ESA satellite program and how we use it. Don't also forget global positioning, GNSS, the GPS system. That's another element that ESA contributes to and can be used in these situations. I mean, clearly to work out where people are. We all remember, I'm sure, the Google movement stuff in the COVID era. There's disease and vector prediction using Earth observation, or indeed any other modeling in relation to the components of health resilience and how we measure them. There's integrating open source intelligence, such as what we're doing within a project related to this conference, the EO4Health, Resilience Activities Project. There's West Nile modeling, for example. There's a virtual observatory, so and all these digital twinning type stuff. There's dissemination of information. Well, we've heard some about that already today, and I'm sure we'll discuss it more. And as importantly, the prevention of disinformation. I would be very interested to know personally how ESA prevents disinformation, and perhaps our handy ESA representative here will help us understand that. And then there's provision of access to or funding to acquire specific help or imagery. So there's quite a load of different things that us as a panel here need to consider. These are the ways that ESA can help. We're also allowed to suggest new activities, how to adapt, how to improve Earth observation, how to improve ESA. You never know. So we can do enough. The field is open as to what we can suggest. And if we know enough about it, perhaps we can suggest things additional that ESA's set of capabilities can actually measure. So not just the things we're familiar with, but open your imaginations about what we can ask to be monitored. So just so we know roughly what we're dealing with, I'm going to ask Gordon, I think. We'll do that now and then we'll do the introductions, if that's all right. To just give a quick overview of what ESA is capable of, because I don't know about you, but it's a constellation of complexity as far as I'm concerned. And therefore, a simplified overview of what actually is out there, what actually can be done, I think will help inform our discussions. So if you're happy to, Gordon, incidentally, is, well, you've heard, he said who he is already, he doesn't need to say it again. So off you go.
Okay, so thank you for the introduction. So I've got a sort of summary of, rather than go into the bits and bytes of the data sets, etc., like C-band radar, and it's, I mean, I don't think you need to you're interested in that. So what can we do with this stuff? What can we do with this stuff that we've got some evidence through R&D projects that it's useful in what we're saying? And I think, I mean, there's two main high-level lines we can follow. One is broadly environmental conditions, and one which we've not really able to do much until, like I was saying, we got much more satellites starting maybe about 4 or 5 years ago on the sort of human activity characterization. So we can do, I think these are the two main lines where we can get a handle on something. So for example, on the environmental condition assessment, we can look at habitat status and habitat change. What does that give us? That gives us, I mean, we've used that, for example, in delineation of reservoirs for particular infectious disease, or it can, if we know aspects of the transmission mechanism, it can give us a handle on the transmission pathways, the environmental conditions under which a habitat becomes a transmission pathway. So, for example, I mean, we've been looking at one particular example is how extended drought and flood cycles in Southeast Europe open up transmission networks for certain types of parasite coming into Europe. So that's the type of thing we can look at in terms of habitat change. Also, with respect to specific environmental conditions. Again, how does a particular area become at risk of being some sort of transmission vector? We can look at aspects of animal management. So where are the animals? How are they being herded? What sort of conditions are the animals being held in? Where are they being moved to? Where are they, etc. And again, I mean, this is can be an aspect of a transmission pathway if it's if the animals are part of the transmission vector. It can also be a blocking factor. I mean, we saw in there was one project we did a long time ago where the practice of having animals sleeping in a circle around a village prevented certain types of tsetse, yeah. So you know, we realise that this is what's happening there. So the animal activity is an issue there. What we've been doing as well in Congo is looking at starting in Congo, also Kenya and places, human animal interaction as well. So getting a handle on the dynamics of that, looking at concentrations of where people are moving to, where are animals moving to for things like, I mean, in Congo, it was for a human gorilla interaction as part of Ebola transmission, but also for some other disease characterization as well. I think the other part of the environmental conditions is characterization of extreme events as either, again, transmission pathways or stressors increasing the vulnerability to particular health elements. So it could be, let's say, flooding, forest fires, droughts, etc. These sorts of issues are themselves problems, and if we know what else is happening round about these events, then we can get a handle on the vulnerability and transmission pathways. So that's in terms of the environmental conditions. In terms of human activity, we're looking at anomalies associated as well, basically settlement patterns, anomalies in particular settlement patterns, looking for, again, environmental conditions associated with the human activity. So looking for changes in the exposure to or change to environmental conditions that increase the risk of particular diseases. I think also in terms of the response, are we seeing anomalies in particular areas associated with disease outbreaks that aren't being reported? I think that's something we started looking at under COVID, which was quite difficult, but we can get a certain handle on that. And then there are other particular human activities where that are associated with disease transmission as well. That's in terms of the data themselves. Okay, what we're also increasingly looking at is how we combine data with models. So what we've been doing with some of the people in the room is things like deterministic models. We know the physics, we know the biochemistry, I suppose. How do we have changes in environmental conditions as initial or boundary conditions on deterministic models for things like risk of transition pathways. Also AI, particular inference. Support vector machine or some other inference type approach for AI models. So again, the Earth observation data or initial conditions, changes in, for example, soil moisture or vegetation moisture or vegetation health. How does that increase the probability of transmission of things like West Nile virus? So that's and then moving out of these sort of the traditional deterministic and AI models, we're also started experimenting with more complex models like agent-based models and things which combining, having Earth observation agents-based models, graph models, fuzzy models, etc. We're just starting with that, but we see a lot of power because in a lot of, I think in a lot of situations, the fuzzy model logic starts to become quite interesting compared to deterministic. It is or it isn't. It's sometimes this is true, sometimes this isn't true, sometimes this is connected, sometimes it's not. So I think that combination of Earth observation and fuzzy models is something that we've started getting interesting results with, and I think we'll be interested to look more at that. So that's a sort of high level summary of the sort of things we can do. I mean, there's more and there's more specifics. If you need more information on particular examples, happy to give it to, but I've been talking a lot today. So
No, we enjoy it. Thank you very much for that. I think it's very clear. It gives us an idea of the sorts of things that we can start pointing to in this discussion. So now I think it's sensible to introduce ourselves briefly. You go a minute or two to explain who you are and justify your existence.
Thanks, Willie. I guess it'd be really sad if we can't justify our existence. I'm not going to do that, but we could chat later if you'd like. My name's Philip Abdmalik. I head a unit at the World Health Organization's Hub for Pandemic and Epidemic Intelligence, which is based in Berlin. The unit that I head is called Intelligence, Innovation, and Integration. And what we do essentially is look for ways to build and strengthen preparedness, prevention, response, recovery, resilience for health emergencies, WHO's capacity to support that, and member states' capacity to implement that in a nutshell. So that's who I am. My background is I'm an epidemiologist and public health informatician. Been with WHO for 8 years. Before that, I was with the Public Health Agency of Canada, which was created out of SARS-CoV-1 when it hit Canada in 2002, 2003. And that's my background. And really interested more to hear from everybody else in the room about how we can use Earth observation, because while we have ideas, I don't think we've necessarily used it very effectively in the health emergency space in terms of preparedness, perhaps more so in terms of response. Thanks.
Thanks, Philip. Gordon thinks he's spoken enough and he reckons you know who he is by now, so I guess it's my turn. I'm William Wint. I'm a mapper, originally an entomologist, and somehow things have gone horribly wrong, and I now spend a lot of time playing around with Earth observation and disease prediction and vector prediction and that sort of thing. I think I'm here because I'm the oldest person Stefato could find to head a chair, and that's pretty much it, really. I think that's as far as I'll go on that, actually. Marius, you need the microphone.
I think I've done it.
You got it. You reckon you've done yourself, are you?
Yeah.
Right. Okay. Hi, my name's Keith Hamilton. I'm a veterinarian by trade. I work at I guess I'd say work at the Science Policy Interface, which is a way of saying I'm not really a scientist and not really a policy maker. But I currently work on this area of biological threat reduction, which is trying to reduce or manage the risks of the deliberate misuse or accidental misuse of science and pathogens. But I've also been working in recent years on emergency management and wildlife health. and emerging diseases. I've been at WOA for quite a long time now, for about 15 years, done a lot of One Health projects, a brief gap in the middle where I worked in Kansas. Prior to that, I did actually work in the field, working on disease outbreaks and things. And before that, I actually treated animals for a while as a proper veterinarian. Well, all vets are proper veterinarians, but, you know, hands-on stuff.
Thank you. Moritz?
Yeah, hi, I'm Moritz Kramer. I'm a professor of epidemiology and data science at the University of Oxford. I work broadly at the intersection of climate and health. Early applications of my work were around using Earth observation data, heavily processed. So I never actually looked at the raw images, more like EVI indicators, for example, to predict vector distributions of Aedes aegypti and Aedes albopictus, but then quickly moved into thinking about how urbanization change, societal change interfaces with environmental change, and how that impacts disease transmission dynamics. Did that throughout the Ebola outbreak in West Africa in 2014, but then also worked a lot on the dengue and Zika outbreaks in the Americas with partners in Sao Paulo mainly. I spent the last 5 years or so focusing on integrating pathogen genomics into the analysis or into the prediction and understanding of infectious disease outbreaks. And more recently have become very interested in climate extreme events and what they do to the societies where they happen, for example, displacements, but also when you have repeated exposures, what that potentially means for how you then react if you already had an exposure to a climate extreme event. And then there's climate attribution a little bit now that I'm dipping my feet into, because there's a group of climate scientists in Oxford that we work in very closely. So I have some familiarity with Earth observation, but I'm primarily a user and don't have very deep understanding of it, unfortunately. So I'm really excited to learn from the panel and everyone here how we can, interface closer with that community when it comes to outbreaks and threats that we face with changes in environment and climate going forward.
Thank you, Moritz. That's very helpful. And we'll be hearing more from Moritz tomorrow morning, I guess, on that sort of thing. Yeah, cool. Luckily, he's a quick learner too, so he'll learn about EO quite quickly. So we have come up, or at least I and Gordon and I have come up with some questions to ask the panel that relates from the social to the technical. So hopefully it'll meet individual panelists' expertise. I'm going to try and follow on from what we've heard from Marius first, and see whether we can discuss that aspect of things to begin with. And the text of the question I've got in front of me here is, we need to distinguish between technical resilience, the things I described a bit earlier on with the pendulum, from social resilience. So it's not, the former relates to health capacities, to case numbers, to response to the environment, and that sort of thing. The latter relates more to the trust in science and politicians, to solidarity, to community collaboration. They do not necessarily correlate. So we have two different pressures acting on how we can respond to health events. The question is, following on from the discussion we've had earlier this afternoon, can technical inputs be tailored to maximize the social elements? So can we adapt what we know from the technical point of view and what we're all, as a lot of us as technical people, are perhaps more comfortable with, but how can we tailor those to make them more relevant to the social resilience and the influences that go on there? Who wants to start on that? Or otherwise, I'll just appoint Marius, because you've been talking about it first. Does anybody want to take his place? No, go for it.
No, I think I can give it a quick start, and then and it's going to be relatively quick. I think one of the main messages I was trying to convey is something I've realized, is that it's not because you have a technical solution that people use it. It seems absolutely obvious, but we found it the hard way. And even, things like vaccines, which are simply a marvel invention to protect people, it was not an easy way. And still no, I mean, there is still lots of people who are absolutely convinced that this was a complete scandal to have pushed vaccination so much. So of course, this is quite far from Earth observation, but it applies equally well to all kinds of, during the pandemic, there was apps, for testing and tracing. In Belgium, we had some of those that were developed, and only a fraction of the people use these. But of course, that's what you can think of integration for future, Earth observation-based products. You can think of interfaces that people can use to assess their risk to a number of hazards that are, that have a spatial dimension. And I think it's not completely out of dream. I mean, I think some of them are realistic, because, and I would take the comparison with many of other apps that people use in their daily life. If they want to, if they track the radar, the rain on their radar, they're used to that. If in Brussels we have a relatively good mapping for air pollution that provides air pollution mapping, and I know that some of the people who are sensitive to air pollution, they track that as well. So it doesn't, it's not. I'm not saying that we shouldn't develop these, but we should be aware of the number of barriers that are ahead of them. And those barriers are educational, cultural, and as long as it's apps and that people have the free choices, usually it's okay. But then you have, there's everything that goes with the communication, so that people actually use it and adapt their behavior. And a very, very difficult balance that I found throughout the pandemic is how to trigger vigilance and not fear. Because vigilance is something very important. It's how you adapt your behavior in relation to a particular threat. Fear is about, when you feel that you are in fear, you freeze, you misbehave usually. It's not the right thing to do. So any communication has to take that into account, even if we start developing apps that use some of the Earth observation data. And I'm just thinking of one potential application of Earth observation data. And with this, I've spoken too much already.
One point I'd like to make, while other people are thinking what they're going to respond to, I've had a bit more chance to think about these questions, is that we often as scientists tend to be a bit arrogant about, well, more than a bit arrogant actually, about these things, and assume that the dirty, unwashed population out there don't understand what we're talking about. That, frankly, is rubbish. During the pandemic, which is we're always going to go back to for examples on these things, I remember my totally unscientific nephew coming to me and saying, "Willie, what's R0?" And I said, "What? How the hell did you find out about that?" The fact is, it was reported in the news a lot. It was one of the maps that the UK people had. And there were graphs about R0, and people talked about R0. And my wife, who is map blind, which she's very grateful for, given that I spend a lot of time doing maps, she came to me again and said, "God, I finally understand what it is you're doing." In terms of mapping, that is. And we underestimate people's ability to comprehend what they're told, especially if they're interested in doing so. So with the COVID thing, people were fascinated to know where it was going. Was it coming to the village next door? Was it high? Was it stronger with the R0 there than it was 50 miles away? And they, as soon as they became interested in it, then there was an impetus to understand these rather more complicated terms, and they haven't forgotten them either. So you clearly agree. Would you like to add to them?
Yeah, well, I do agree, actually. And I think sometimes scientists need to be humble and communicate uncertainty. And I certainly personally, it's not an institutional position, but I've been in situations where scientists have been wrong, but they don't often communicate that. They say they're right. And during the foot and mouth disease outbreak in the UK in 2001, we had two different groups of modelers with contrasting opinions on what should happen to the culling policy in the UK. And one set of modelers were saying, you need to kill all the sheep, you need to do this. And they were arguing against the government modelers that were saying something different. But by wheeling and dealing, they managed to get direct communication with the Prime Minister of the UK. So it created a real problem that you had two conflicting groups of scientists who both thought they were right when it comes to modeling. And one group had to be wrong, but they weren't humble enough, I think. And I'm not sure that scientists make the best politicians either, because politics is about compromising. And another experience I've had is I was involved in the mission to Wuhan to investigate the origins of COVID-19. And you could see a lot of scientists becoming politicians, but not without the competencies that politicians have, because politicians, it's not about saying you're right or wrong. It's about reaching a compromise and listening to people. So I think when it comes to building trust, you have to communicate that uncertainty that what I'm saying might not be right, but on the balance of evidence at this moment in time, this is the best theory we can give you. But I don't think that uncertainty often doesn't always get communicated with the opinion.
Yeah, thanks. I mean, there's a lot there that we can unpack, and certainly, learning how to and what level of uncertainty that we're willing to accept needs to be something that I think needs to be discussed more. In your example with the modeling, Keith, there's the saying that I'm sure many people here know, which is that all models are wrong. So obviously both sides were wrong, but some models are useful. So I think that's something that also links back to what Marius was talking about in terms of just the complexity of the ecosystem, where everything is connected. And that's one of the things that we saw during COVID, was that traditionally in public health, we tend to draw up these epicurves and we look at numbers of cases across time to try and understand the course of the outbreak and how it started and how it's spreading. And we sometimes neglect to incorporate into our thinking all the other impacts that we also saw during COVID, like the economic impact, the mental health impact, the years of education lost. And so how should we better prepare for those things in order to create more resilient societies and resilient individuals and resilient health systems? During COVID at WHO, and you've already sort of alluded to this, is, we saw a lot of people getting involved, a lot of what we call armchair epidemiologists, all of a sudden having self-proclaimed degrees in epidemiology. And while that in a way is a good thing because people are interested and involved, it also leads to a lot of confusion, miscommunication, and misinformation. Not necessarily on purpose. There is also disinformation on purpose, but just out of, ignorance or not a full understanding and proper interpretation of things. And so I think part of your question at the beginning around technical resilience and social resilience is how to bring those two things together in a way that involves the community, but at the same time builds up that trust that we're all talking about. And maybe just to bring it back to Earth observation, because I was told I have to. So I think, I don't have the answer, but I think whatever we end up doing with Earth observation, one of the important things is, again, to make it so that whatever's being used to inform the decision-making process is also transparent and visible to the public. And I'll give sort of maybe two examples of one from academia and one from practice. In academia, during COVID, there's a group out of Boston that used satellite imagery of traffic or in the parking lot, how full parking lots were in hospitals in Wuhan, to go back and retrospectively look at, could we have sort of predicted something was going to happen earlier? And they did find several weeks in advance an increase in the number of cars, an abnormal increase in the number of cars parked at certain hospitals in Wuhan. Now, whether or not there's a causal link there remains a question. Can't necessarily say that that was the precursor to COVID, but nonetheless, it's an example of how using something that a lot of people could already access and understand could be leveraged to communicate something to the public. The other example is during when the Malaysia flight went missing back in 2014, and the public were involved in the search. Basically, this company made all the satellite imagery available, and the public was scouring. They crowdsourced it, right? Help us find the flight. I don't know how we can necessarily translate that exactly into involving the community in pandemic and epidemic preparedness and response and recovery, but it just strikes me as a way to think about how we can involve them in the process, and in doing so, build up that social resilience through trust building, community building, and making them part of the journey rather than just a society to which interventions are dictated. And we've seen during COVID what that does in terms of eroding trust and what happens as a result.
Yeah, I mean, I think talking about some of the examples, I think, and the idea of understanding and trust in it, I would say when you're in complex situations where you've got different experts all coming together, I mean, one of the added values we've seen in law enforcement situations is everybody can sit around satellite image or an image derived data set and point to different bits to say, oh, that bit and that and there and whatever. So it might not be the data themselves in the satellite data that are being used, but I would also expand the discussion to say it can be the context in which other discussions can usefully take place as well. So I wouldn't just focus us on what can we get out of the Earth observation. It's more general. How can the Earth observation help in all of the possible directions?
No, I take that. I think this thing of comprehension of what the messages are is important. And I know, I'm sorry, Moritz, but I know you weren't very keen on this question, but the technical information that your stuff relies on, climate and extremes and all those sorts of things, we'll come on to that in one of the other questions, as you're aware, with tipping points. But it seems to me you have a huge challenge into getting across to people what that actually means. I mean, we're fed up to the back teeth of climate change. None of us bother to listen to it anymore. I mean, this is what I'm told at home. You know, we don't believe it. It hasn't, or if we do believe it, there's nothing we can do about it. So why get worried about it? So how do we translate the technical aspects of your interest at the moment into something that is societally relevant? Do you think we can do that? Or how do we get them to believe it?
I mean, can I make a point about
you can.
Yeah, before I go there, which is on, and this struck me always, and maybe Gordon, you can respond to this when directly at ESA. So these Earth observation data are so high resolution now.
Yeah.
Which makes us be able to do things like track the number of cars on car parks, which has commercial implications and all sorts of other things. We were looking at the H5N1 outbreak in the US. None of the farm data were ever made available by the different commercial companies that run them because of fear of commercial implications, which are completely understandable, I think, for some. But then you could look on Google Earth onto these farms and by hand count how many cows and how dense they are together. So I'm wondering how you address the potential misuse that arises from the availability of these data to be at this high resolution. You know, we had to think about this in the context of using human movement data, where they get aggregated to certain levels, so the individuals are not identifiable, but still there are some residual risks and there are frameworks around this, and I'm sure it's the same in your community, but I'd love to hear, because as we all think about increased use and uptake of Earth observation in making any prediction about things that are not necessarily temperature related or related to the environment, but much more to the people that interact in these environments and the animals that are in these environments and what that means for conservation. I think there's a lot to talk about, but I just wanted to maybe see how, if we can briefly talk about this, because it strikes me as something very interesting and relevant.
So in order to be able to, I mean, I think you've put your finger on a worry. I think for the most of the data that are available, in particular all the data from ESA, I mean, the best spatial resolution we get is 10 meters, so it's not really, you can use it to a certain extent. I mean, things like if you're seeing anomalous herd culling or something, there will be signs if you know what to look for in these data. You need to be quite expert to be able to do that, but yes, you could do that. For people tracking and things, we're using much higher resolution imagery, but I mean, there's also mobile phone network data that can be aggregated as well. So I mean, there's a lot of these different data sets that can be put together. It's still quite a complicated thing to do. I think, I mean, the processing involved in getting to what a particular individual or a small number of individuals were doing is probably, I mean, unless you really, are an evil genius in a hollowed out volcano, it's going to be, you'll find other ways to do that before you're using the satellite imagery. But I agree, it's something that we have to think about. And for data that are sort of for law enforcement purposes, we don't have the free and open data policy. It is restricted to particular organizations.
Things are developing very fast, though. I mean, is that presumably is that situation is going to change in future? Is it?
Yeah, I mean, there is a worry about how, there's discussions in between ESA and the European Commission about certain this free and open data policy. Does this stay for absolutely every single data set? Are the thresholds? How do we manage that? We don't have the answers yet. It's a discussion that's going on.
No, super helpful, and thanks. I also, maybe just to build on this, the moment we start thinking about individuals' health and particular interventions then being made, given potentially their health status or their vulnerabilities, then all of a sudden the implications of that obviously much greater, especially for insurance companies, repurposing this information for targeting different populations, different policies and so forth. But it sounds like you guys are thinking.
Also bear in mind, I mean, as time goes on, we will be inventing new ways to address these different problems. So it won't just be the insurance companies. I mean, who knows, it could be Facebook next. I mean, with AI, with AI out there and people being able to access it and smaller units being able to produce more results, I think we're at the beginning of something that's going to change so rapidly. We'll be struggling to keep up with it, to be honest. Can I just force you back to the technical bit? In that how some of what's available in from the imagery at least is really deeply complicated. I mean, Gordon talked earlier on about file names this long, but I mean also they're not natural knowledge for most people, and they're also deeply skeptical of a lot of the climate stuff. So do you think it is going to be difficult to translate some of the stuff that you do or some of the stuff that's more climate orientated into something that people will believe?
I think generally, there are tremendous challenges in the translation. I do think, even though there are some of these challenges, we shouldn't not do science, right? I do think we should still continue to try to build up evidence about the impact of certain factors that are climate related and might get worse in the future, and what that might mean for disease transmission dynamics, for example. I have seen a gradual shift, however. So I think when we first produced our scenarios for Europe and how the invasion of Aedes albopictus might go much more northwards, there was generally a bit of, because people hadn't experienced it, they would go out and say, well, it's not really a problem for me. But then lots of people go to Southern Europe for holidays, and in the summers they'll be bitten all the time. And then they start realizing, okay, well, this is a problem. So, as with many things, once you get sort of in touch with the issue, then people start texting me saying, oh yeah, I saw this mosquito with these little thingies. Like, is it this one? Is it that one? Well, and I send it onwards to Willie because I actually never went to the field to know how they really look like. But I do think, you know, there is a shift, and we now see these outbreaks in Southern Europe, chikungunya outbreaks in Italy and in France, quite, you know, getting bigger and bigger every year. People traveling to Brazil last year in 2023, 2024 with these massive outbreaks, coming back with dengue. So there's more of an awareness, I think, across the entire population that these things are happening. But yeah, the closer they are to realistic, you know, already felt impacts, I think the more you'd see that happening. And maybe just to have one last point, you know, in the past, lots of people have focused only on temperature to be a main driver of the shift in the populations of mosquitoes, and then predicted in 2050 we might have Aedes aegypti in Alaska. And that's pretty unrealistic because there's only very few days a year maybe where they're suitable, plus there isn't much travel between currently infested areas to others, and it would need a lot of transport to go and bring these eggs or live mosquitoes there. So I think being very careful in how we do our work is really important, not to make sort of scenarios and only showing the worst case scenario, but like showing a whole range and not just focusing on you know, the billions of people affected in the future, but like giving a bit more context and being nuanced about that. Also in talking to journalists, not just in talking to the journals about this.
I think the best case, worst case is an important thing. And you made a good example. You've got to, well, people have got to realize it's relevant. And I mean, I don't think that we've yet got to the stage where EO is seen to be particularly relevant simply because they don't understand the links and what comes out of it. I think that's definitely the case. But also on the other side of the coin, the best case bit, I mean, I can't remember whether it was here or not, but you know, we're now hearing that in Southern Europe in the summer, it's too hot for anything sensible vector-wise to survive. And so it is actually also capable of bringing good news in a sense. So I think we need to make sure that we're not only focusing on the downside, you know, harbingers of doom and all that sort of thing. But, you know, we can use it to cheer people up a bit. And one of the things that, again, the rest of my family is definitely not involved in science. And, you know, they asked me whether I got a proper job yet. They're not interested in science, and they're certainly now not interested in anything that comes out of the climate lot. They just think of them as doom mongers. You know, we're still here. So, and anyway, we can't do anything about it. So we need to combat that as well, I think. And one of the ways of doing that is saying that it's not just all doom and gloom. We can come up with some good things. Does anybody else have anything to say on that particular link between or contrast? Yeah, Keith.
Yeah, just 2 points actually. The first is just going back to the transparency thing, because a use of Earth observation data, because the way that our organization works is countries report outbreaks of important animal diseases to us, and we let all our other member countries know, and then they can take measures to prevent the importation of those diseases, but those measures have to be based on science. So there's disincentives for countries to report disease because trade becomes blocked. So there's financial disincentives. So we know that there's sometimes some underreporting of animal diseases. So this is just a potential application where you might see die-offs of animals, which might conflict with the information we're getting from our member countries. So this is a role that Earth observation has to play in gathering disease intelligence, and then we can put a bit of pressure on our countries to report an outbreak. The second point was just going back to what Moritz is saying, and just, this is Anna Maria's point actually, but really kind of Earth observation data can be more powerful if it's used in combination with other data on the ground, whether that be observational data from tourists that are getting bitten by tiger mosquitoes, or whether on the animal health side it's being combined with vector surveillance or animal disease surveillance, serology, and antigen surveillance. So combination of data sets, Earth observatory data and ground surveillance data can be maybe a little bit more powerful sometimes and convincing
Yeah, and one of the things that colleagues in ESA have drummed into me over the couple of years I've been working with them on this is that there are other Earth observation providers out there. I mean, actually, funnily enough, we've been here for 4 hours and the word NASA has never been mentioned. I mean, I appreciate they're the devil and all that, but they produce different things, and I know that combination happens. I know collaboration happens, and there are other, as Stefano often tells me, there are commercial operators and producers of imagery that. So we're not. ESA's not just operating in a vacuum, and actually, it's very good at collaborating with them as far as just to give you.
This is an area where we could actually be collaborating with NASA. NASA were invited to.
Were they?
This event, but because of the current
funding,
they weren't. They couldn't get the travel. But we're trying
to. And the Japanese, and I guess the Chinese too, probably.
Yeah.
So I mean, there's a deal of potential, I think, there for things that can be done in the future. I'm conscious of the time. Actually, it's gone rather more quickly than I was expecting. We were going to talk about how to turn scientists into political powerhouses, but we might leave that till the end. And I think probably that it's best now to go on to a more technical sort of question, which is how do we know when to be worried? How do we know when things are getting out of control health-wise? How do we know when the tipping points have been passed? How do we know when the indicators have reached that stage when we should be sitting there locking the doors or running away? Are we capable? Do we have the machinery to and the knowledge really to identify these things, or are there proxies we can identify? And they don't have to be, temperature proxies or NDVI or any of these things. They could be people putting up umbrellas because it's too hot. I mean, we're not limiting ourselves to environmental tipping points or anything. And linked to that is. Does this mean that we really can provide early warning for health events that affect resilience? Because in order to do that, we need to know what we're talking about. We need to know these indicators actually work. We need to know what the tipping points and the indicators and the proxies are. Are we at a, and I mean, certainly in my professional career, I can't tell you how many projects, papers, whatever else, I have been involved with where early warning has been included as a bandwagon. Very few have actually come up with what I would call an early warning system, which meant you could pick it up and say, yeah, next Tuesday, we're going to have a problem. They put it in the title, they put it in the discussion, but they never actually deliver much. So my question is, do we have the knowledge, and can ESA help us provide that knowledge to provide an early warning system, or at least identify when things are going to hell or getting better? Don't mind. I guess, I'm sorry, Moritz, I know you again, but this is your thing more than it is ours. So I'm wondering whether you would like to kick us off on that.
So I think there's some indicators that ESA can definitely help us with. There are others, they might not be perfectly positioned. There was a great piece last summer in the heat waves in Europe that heat-related deaths in Europe are spiking at temperatures, I think, starting at about 30 degrees, and then if they don't go down in the night. But in the United States, they keep relatively flat, and that's because of the use of air conditioning. I don't know if ESA has the resolution enough to identify if there are air conditioning on the side of the houses. But just to say, resilience is not just, resilience has to do with how well a country, a household, individuals are prepared for an adverse event, which in this case would be an adverse climate event. I deal a lot with early outbreak dynamics. So, for example, when there's a new outbreak of Marburg, Ebola, new cases in Argentina of pneumonia were identified, there's a lot of money that has gone in to get the first sequences very quickly of identifying what this pathogen is and how it might have evolved. Not the same amount of investment has gone into actually understanding the context in which these outbreaks are happening in. So when I talk to teams then in country, they're often saying, I talk to them, oh yeah, but you must get there quick to, do delivery of vaccines or do delivery of any sort of other intervention. And they say, well, but I can't actually get there because there's flooding on the roads, so I can't get through. So I need other types of equipment like helicopters to actually get to the site of where there's an outbreak identified. So having more, I guess, just putting it out there, but is there a way we can closer collaborate in these emergency situations with Earth observation agencies to try to get in that moment the relevant information for that particular context we're operating in? Now, we can do a little bit ahead of time in preparing for these kinds of data to be there, but very often it needs a group of very dedicated people to actually get the information to the right people to then use it for their outbreak response, which then means you need to have basically staff that is available to do so. And I wonder how ESA operates, right? What are the operating procedures? Do they have people in place that actually can do this work when an emergency is sort of happening? So that's just an example of where I could see like really great collaborations to appear between the health people and the people on the Earth observation side. We think a little bit about cyclones and their impact on downstream outbreaks of disease. That can be direct impacts through flooding, contaminated water, and then that outbreaks that result from that. The missing piece is often how did people move after the event? So understanding displacements that occur. So that was particularly strong during the recent cyclones in Malawi, which caused a huge outbreak of cholera. And I'm sure people in the room here have examples of their own where the population movements that happen as after or a little bit before such an outbreak such an event occurs is critical for downstream modeling. I didn't answer your question, of course, whether we can ever possibly be prepared, but these are just a couple of things to say that I think are relevant in this context.
Yeah, sure. I think maybe a good example on the animal health side is often when we're responding to things and the indicator is disease in animals, but for zoonotic disease, that's often too late. Certainly from my experience, Rift Valley fever and H5N1, you're getting, that's avian influenza, you're having human cases acting as sentinels for animal disease because the surveillance just isn't strong enough in animals. So Rift Valley fever is a good one because also to do anything about Rift Valley fever, you need to be really ahead of the curve. You need to vaccinate before the outbreak. You need to have your risk communication messages rolled out before the outbreak. So if you're acting on cases in humans, it's too late because it's already really widespread in animals and the risk is already there. So I think with Rift Valley fever, we're kind of seeing that there are these predictive models that are improving with time. I know that Anna Maria is probably going to talk about that because Teramo is working on this Provna project. And each year there seems to be an incremental improvement in their power of prediction, but again, important to combine with the surveillance on the ground. But I think that's a good concrete example where if you just rely on detecting human cases, you've gone past the tipping point. But if you use Earth observation and animal disease surveillance, you can take action earlier.
Yeah, I mean, Rift is a good example because it's been going. I mean, it was one of the classic things I learned about as a student, for heaven's sake, and that's a long time ago. So we've had a lot of experience at that, and it's one of the few things I think that has come up, and it is, I think, in operational use pretty much. Marius, have you got any thoughts on this? Sorry.
Yeah, I think there are numerous examples that we can find in the literature or with many diseases where I think Earth observation allows to early detect some of the conditions that are prone to disease spread. And I think there's a number of disease systems in which this works. I mean, retrospectively, I remember the paper on Ebola in West Africa, which for me was really quite an instrumental one that was using, data out of outbreaks that had been happening before the outbreak in West Africa, showing that this part of West Africa was suitable. And people, and of course, this paper was published, unfortunately, after the outbreak, but it could have been produced before the outbreaks. And it could have saved some detection time because there was a delay in the response, a delay in the recognition. This was Ebola because it was not expected in this part of Africa. So I think this is a very nice example that demonstrates how Earth observation data, when integrated into many models, can provide a good lead time and can help having a quicker reaction to a disease even when it starts to unfold. But then the question is that what do you do with that lead time? Because we also have the counterexample of the pandemic. We had several weeks of lead time. You know, many of the disease parameters were already known from the very quickly. The Chinese published excellent data on the transmission, and yet when we were speaking to authorities, somehow I remain very frustrated by my conversations with policymakers at the time, because somehow they felt that, yeah, this is a remote problem. This is something that when it's going to come to here, it's going to be different. Somehow they have this impression that it would be different. So what do you do with that lead time? So I think what is important, I think we should continue making developments that integrate Earth observation into characterizing the conditions that are prone to disease spread in space and time. It's a highly valuable use of Earth observation data, but we have to work in parallel with the connection with what can we do of that lead time we are saving. And that's, for me, a very important aspect to work in connection with the developments we're making.
Yeah, I agree. I mean, time is clearly critical, and one thing about EO is that it's quick, mostly. So that's obviously an important thing. I would like to point out here, before moving to my left, just so I get a word in, there are two levels, there are two audiences for early warning, if not three. There's the academics, so we can write papers about it and see if we get it right. So that's one. There's the people who are responsible for doing something about it. So with public health, maybe government, whatever else. And then there's the actual citizens. And it seems to me we need three different sets of information. Because if Moritz went to the citizen out there on the street and said, I've got a paper, it says, they're going to look at you in a strange way and say, go and have a beer. But equally well, if you go to a politician, as Marit ably said this afternoon, you've got to be really careful how you do it, because otherwise you can get yourself in all sorts of difficulties. So I think we need to be aware of what audience these early warning outputs need to be, rather than just saying it's a blanket phenomenon. In that context, can I move to my left? And I don't mind. You want to say something? You always want to say something.
No, thanks. Maybe just to comment on a couple of things there. I like I said at the beginning, I'm curious to hear from everybody here how we can use Earth observation and to use it more effectively. I fully agree, and these are different areas we're working on at WHO in terms of how do we translate findings for the decision makers and the politicians, and that knowledge translation piece. I think as long as I've been working in emergency preparedness and response, which is over a couple of decades now, that's always been a bit of an issue. But I don't think, maybe coming to the last question that you said you'd save to the end because it's been touched on. Yeah. I don't think you're going to convince politicians with science at all, ever. That's not going to happen. And so I don't think the question is how can scientists have more political power. I think the power comes through coalitions in a way. And so I think it's by pairing and partnering scientists with the right groups who have that influence as well. And by doing that knowledge translation bit. Like you were saying, I mean, you can gather around an image and have people point and understand. And so when you translate content in a way that then makes sense to the platform, to what resonates with constituents, to the communities, then the politicians, I think, will listen, especially when you have that coalition.
Thank you. Thank you for that. Gordon, do you have a...
Just, I mean, I can come back on the question on the response characterization. So yeah, I mean, there are a number of organizations that will do that as an emergency response support. Some with longer lead times than others due to the nature of what they're looking at. So WFP, like for onset of crop failure, they're looking at the condition. I mean, they're monitoring when you know what the rainfall or what the rainy season is. So you start getting worried if there's no signs of planting happening 10 days into the raining season, and then you're looking at what else is around, because if you're too inaccurate on your crop production estimates, if you bring too little food in, people die. If you bring too much food in, you kill the people that do have food, you kill their markets, and they're not growing next year. So you're propagating. So that's a longer lead time activity. Whereas the EU SATSEN or UNOSAT down in Geneva, they're doing the emergency response, really looking at the sort of thing you're saying. What's trafficable? Where are people? Where have they moved to? What facilities have been set up? What are the resources around there? If there is a camp, do they have firewood? Do they have access to clean water? All of that. So that's all being done. I think in terms of there was another point. How do we characterize outbreaks very, very quickly? I think if there are signatures that we can see, and I think a lot of the exercise is signatures or proxies for what's actually what's happened in the outbreak. I think one of the other value we've seen in satellite data is it looks everywhere at the same time, more or less. Okay, so it's not you're sending inspectors into one bit, not somewhere else. You can look at a whole wide area and build up a picture much more quickly and much more coherently and consistently than you've got one team here, another team from another research group there, and there's a sort of there may not be total consistency in the analysis methodology, the results, etc. So that type of issue is also eliminated on the basis of wide area consistent data being collected very, very quickly.
Does anybody out there, do any of you have any comments on this? We need to get a microphone to them. Yeah, whoever you are. I can't see, but
yeah, here you go. Well, it has to go to the...
Sorry to spring that on you, but
this is on, yeah, this is on already. I would like to jump on this topic and this kind of elephant in the room of the key challenge for science communication in current times. And I feel like one of the main problems also that we're facing is that news are that, well, how to frame this? We have a very strong influence from the technological side on platforms, including social media. And this form of algorithms that are used, they hook very strongly onto emotionally told stories. So very, emotionally appealing stories. And what I find a bit, what I ask myself is, how can we support science communication, true science communication, in a form that is as emotionally strong as the negative stories that we see on media?
you mean in terms of providing solutions to the things we see out there? Can we provide positive stories, emotional stories that would combat the negative? Is that what you mean?
Yes, to create kind of like a neutral counter action, counterbalance, to what usually the attention economy that we are living in at the moment, which is driven by algorithm and technology mainly, that we can have a grip there and actually not lose the audience. We were talking about the broader mass audience that is trying to orientate itself in this jungle.
Okay, a good question. You asked it. Do you have any answers?
Well, I think of the usual, communication formats as being more interactive, finding, and that's not going to be a super easy task, but finding people, let's say influencers, just like they exist at the moment, that are strong enough or powerful enough and create communities around that. Because it's as you said, it's a combination of people that have the access and understanding to scientific content, but can communicate it in a way that is engaging enough. And I think this could be a kind of like a key role that we're looking for.
Okay. But the main message is that A, we obviously need to be better at communication. But
yes.
B, we need to have a balanced output there. So it's not all disaster and ghastliness.
Yes,
it
exactly.
is something to provide us with solutions and hope.
Exactly. Because if you look at, for example, if you look in social media, which stories catch these gazillions of views, it's not only the negative stories. There's a lot of examples out there that are about very simple, kind, or positive messages, but they're not like, it seems like nobody's talking about that, but that's out there too. And I think it's probably the smaller number of these examples that are around. So how can we support these kind of dynamics? Like, did we ever think about, like, I'm just thinking out loud, did we ever think about any kind of collaboration with social media or with communication experts?
Well, I mean, I think what we heard from Marius earlier on this afternoon is, yes, it has been thought of, and yes, it's very, very effective. So I, mean, I think it's out there. I mean, and if your point is that ought to be done more, and there ought to be more emphasis on broader methods of communication and not necessarily such gloomy messages, then fair enough. Does anybody else have any? Oh no, you were next, weren't you? No, Marita was next. Oh, you get okay. Go on, Shubna. You go then, Marita.
Piping up too often, maybe, so I should.
No. We won't give up your wisdom. Go for it.
I wanted to raise the point that perhaps we are talking a lot about sending our wisdom down, the top-down kind of an approach. Could we also could we also think about getting information from the bottom up? And in that context, maybe a citizen science kind of approach would be good, where we are actually, it's a mutual communication, and we make them part of the solution. It's also related to building trust point that came up earlier.
I mean, we do it with vectors quite a lot. There are various apps out there for vector-borne distributions. Yeah, I mean, if you can think of ways of doing it in the context that we're talking now, which is essentially disease and fairly hard information so that we know what to do, which I think is the whole point of this, then yes. Has anybody here got any comments on that? Yes, Marius.
Yeah, I think it's incredibly important for different reasons. The first one is that, and that is more technical, it provides ground truth information. Of course, you could have lots of noise to signal ratio, because you don't always know the quality of the baseline information, but that's something we use to handle. But I think it has a secondary benefit, is that the people who get involved, there's no better way than that in order to communicate that there is an issue that is important, and they will speak about it with their community. And by doing that, you also have it partially respond to your comment, because in all I mean, we've developed since a few years, an incubator to participatory science in my university. And what you see is that people who participate to those different programs, they get to understand how science works. So it's an incredible, powerful mechanism for people to understand how science works, that science is based on evidences, on data, and that it's the contrary of politics, that, you know, if two scientists disagree, by the end of the day, it's the data who is going to tell which one of the two is truth, which is completely different to policy making. So it's a great mechanism by which you can, A, collect ground truth data, to get engagement of people around a specific theme that is connected to a disease or vectors, and to pay attention and to communicate with their neighbors, with their community, about breeding sites, about lots of different issues that are connected to the topic of interest. And three, you get to communicate about how science work through with those community. So clearly, this is a very, very important instrument, I believe, that complements extremely nicely the kind of observation you can have from remote sensing.
I'd just like to endorse the thing about validation, because validation of our interpretation of conditions, or what, you know, are these things happening where we think they're going to happen, for example. There's something called GeoWiki, which has been out there for years, but are used to validate actually habitat and land use definitions. And it's worked quite well. I mean, it's been going for 20 odd years, I guess. And people can click on a thing and say, no, that's not desert, that's my back garden, or whatever it happens to be. And they've been doing that. And I think validation using citizen science or citizen observations is a much untapped way of making sure we really do know what we're talking about. And I think it's also particularly apt for Earth observation, actually. And not just yet, because Philip got his hand up for you, then you can.
Thank you. So earlier I was talking about exactly this, right? When I talked about the armchair epidemiologists, and how do we harness that? Because clearly there is an interest, and we also, the other example I gave, which was more specific to Earth observation, was the communities around the world coming together to try and search satellite imagery for the missing flight. And that's why I also said it's important to make them part of that journey. But the point I want to make is that that journey needs to begin before an emergency happens. That collaboration with citizens needs to start now, and it needs to be continuous, and they need to be part of the process, like you're saying. And I think it's the same as well with, you know, when I worked in the federal government in Canada, I don't know if I should be saying this, but I worked in emergencies, and we sort of had this saying that, yes, you can have our data, but only during an emergency. And of course, then it's too late. And so it's the same, whether it's Earth observation data, whether it's engaging citizens, whether it's collaborating together, forming these coalitions. They can't just happen when an emergency hits. And that's why it's important to be having these conversations now. And then what are we going to do about it after this meeting is over, I think is what I'm really interested in. Thanks.
Gordon, you are vibrating with keenness next to me.
Yeah, no, I mean, that's clearly something, that we would be really interested to do more of, these type of exercises. I think there's two possibilities there as well. One is, you know, the sort of collaborative citizen science and the engagement, etc. The other part that we're looking at is a sort of more of the whistleblower type approach as well, in terms of how can people point out what's going on in a situation where they might not be allowed to, and be protected, and have that that information validated to the extent possible by independent Earth observation. That's a sort of mechanism we're looking at as well, more for things like environmental crime right now, but it could be something that we could use for disease outbreak and things as well. People just reporting and pointing out what's going on, and we're able to validate that with high resolution imagery as well, or derived information as well.
We have 4 minutes left, and happily there are 6 panelists here, so we're all going to have to be a bit quick. All of us do just to find. Okay,
Really, you're just hardly forgetting me. That's fine. I will remind you. I'm not sure if this is what you meant to say about citizen science helping science to do better, because I thought it's my first time at the ESA, so I apologize. But I felt that it's a very single issue mind about outbreak, pandemics, whether we're going to have a next COVID. That's not going to happen. It might be something completely different. So the importance of what, because I also felt a little bit with Maria saying like, oh, and then we can explain science and then we can tell what is important. Maybe it's not to the scientists to determine what is important. Maybe there's more information about what the people are worried about, all kind of other things about global whatever. And not only infectious diseases, because if you look at the disease burden, infectious diseases is not what the people think about the whole day. So I think the scientists, and I'm from the government, so and a scientist, also have to really listen and not thinking they don't listen to me because I tell you this is important and they don't find it important, because they have other things to do. That is much more important at that moment. And I don't think we have a grip on it. So it's not about citizen science, I think, to do better physical science, but to have social scientists, not to get data, but to, they have all, I'm not sure how much Earth observation is helping social scientists. I'm not a social scientist. I think it's super complicated, but our science is also very complicated. So maybe we should have some social scientists who know what people are going to do instead of, because the people who decide are very single-issued in the disease outbreak and trying to minimize it, and we have no idea what people are going to do. So I thought you were going to say that bottom up is that you get information from the people on whatever, not about whether they find a mosquito or not, but what they are moving, going, if they are big, if they are, I mean, with COVID, we know that there's some comorbidities that is determining everything. So I thought it should be a little bit more broader than the single issue, because we say it's very integrated, but it's all we have been talking about is, I think, infectious diseases at this moment and outbreaks, and not about other things that are happening, in my opinion. So I felt it was very single issue.
Yeah, sorry, I was just giving an example. Mea culpa, I agree.
Yeah, I also agree. And at WHO, we're not just focused on infectious disease either. We're focused on conflicts, on humanitarian crises, on natural disasters. There's a mental health. There's a whole non-infectious disease component to WHO. So these are all crises. These are all crises that affect human beings, and we're very.
But during those crises, people are just having a life. And that's very often forgotten, that what we are thinking about is not on their agenda. And I would wonder if people are asking about gaps, it's the gap of what people on the ground are doing in the daily life, why the things we're here concerning a crisis is not ringing, because people on the ground are not idiots. They know what is important in their own life. So there's something missing. It's not that they don't understand. And that's also what we said. People on the ground are not stupid. They have other things to do. So it's not the stupidness, I think. It's appreciating that they have other things to do than what we are doing.
Mm-hmm.
Yeah.
Thanks. I think there's another.
Hi, thanks. I just wanted to circle back to the science communication topic and some of the things that were discussed. Because as scientists, we talk a lot about collaborating with the communications people when there is actually scientists on the field trying to communicate and like producing communication materials, myself included. And there is this at all the levels, so master students, PhD students, postdocs, and maybe one of the problem is, you know, the hierarchy in academia. Maybe that's one problem, but the other problem is that we always talk about, the communications people. And I'm not saying that all scientists need to know how to communicate these topics to what we call the general public, but that some of us are willing to, and are also willing to keep up with what are the communication media that general public are following. And that it's important that as a scientist, we also empower each other, because it's not just, oh yeah, it's a side project, my communication, I don't know, Instagram account. Like, people are actually learning on social media and things are changing very fast. And I feel like sometimes we just sort of diminish it or try to hide it. And then we come up with, yeah, science communication is very important, but maybe we don't give it the right place it should have. So yeah, that was just.
Okay, I mean, it's fair. Obviously, there are people trying, but I think from the perspective of the rest of us, there just aren't enough.
Yeah, there's not enough, but that's why we should encourage and empower ourselves as scientists to share our knowledge. And it's not that we are imparting wisdom, on the general public, because the general public are willing to learn and they want this information. So it's not.
But not all of us are that good at it. That's the trouble. Most of us
Exactly.
are crap at it. I think, well, we're past time and we've got somebody geared up to do the next thing. I think we have to stop at 1850, which is in the past now. So I'm going to draw this to a close, I think. I know this could go on for a while, but it's not going to. It's clear to me that the overwhelming issue here is not the technical contents of the imagery as far as ESA is concerned. It's communication. It's communication at any level you care to mention, from the field, how to get the stuff across from labs into people's minds, how we interpret the imagery, but it's not really the technical aspect at all. It is how we get the information to the various different people who need it. I think that's without a doubt what everybody's been talking about. So on that happy note, we need to learn to communicate. And one of them is our time is done. Thank you very much indeed.
Hello, hello.
It's fun right now, if you want to talk.
Okay, if anybody's listening, I see the panel is being emptied, so, I wonder if, yes.
Yeah, just 1 minute. We are getting ready.
Okay.
Okay. Good evening, esteemed colleagues. I was just very spontaneously asked to introduce my colleague, Dr. Christian Frey, documentary filmmaker from Switzerland. I will just briefly introduce him. Dr. Frey is one of the most acclaimed documentary filmmakers of Switzerland, if not in Europe or worldwide, has been awarded numerous awards for films like War Photographer, Giant Buddhas, and Space Tourist. And just recently, he has published a new documentary film called Blame, which is addressing some of the critical topics that we discussed today. Thank you. The stage is for you.
I hope you can hear me.
Yes.
That's wonderful. I mean, apropos communication and attention economy, I know you're all longing for dinner, but if you would have 10 minutes for a filmmaker, that would be wonderful. I try to be short, 10 minutes. And, you know, I was always interested in science topics, you know, like a film I did, Space Tourists. Miriam, thank you for introducing me and mentioning this film. But it was the story of the first female space tourist in history. And I not only followed her and her journey to the International Space Station, but also the journey of Kazakh steppe space debris collectors, which is a crazy story because the 4 boosters of a Soyuz rocket are actually collected, and many people
Yeah,
don't.
Christian, I'm sorry to interrupt you. We lost your picture. If you could wait for a couple minutes. Thank you, Christian.
All right, I hope you can see me or at least hear me. Oh, yes, I see now that I'm on the screen. I did a film on love also and the science of love, working with Helen Fisher. She's a New York-based anthropologist, and were actually interested to look into the brains of the recently rejected, of the lovelorn. So that was another film about science. And then I did it, Genesis 2.0. This is a film about mammoth tusk hunters in Siberia and about a science superstar, at least for media people, George Church. You know, you might know his book Regenesis. It's a book, How Synthetic Biology Will Reinvent Nature and Ourselves. So yes, I was always interested in science, but now I'm going to pitch you about Blame, a film which dives into the absolute very center of the COVID origins debates, you know, lab versus nature. 3 years ago, I was attending the World One Health Congress in Singapore, and it was incredibly interesting for me to follow the scientists and their debates and their presentations. What did I do in Singapore? Well, the host or the co-host of this event was Professor Dr. Linfa Wang. He's one of the most important and most acknowledged bat virologists. And surely I love bats, and I fell in love with bats. And but that was not my basic interest, because there was another guy attending the Singapore One Health Congress, and his name is Peter Daszak. He is the head of the New York-based NGO EcoHealth Alliance. And the third scientist you might have heard of course, is Zhengli Shi from Wuhan. Yes, from the very lab being scrutinized and being, you know, in the middle of these speculations about COVID origins. So what did I do actually? I read you shortly just a synopsis of my film. It is a film about 3 scientists who, after, you know, years or even decades of bad virology, are catapulted in the hard spotlight of politics and serious accusations. So don't start this film with the COVID outbreak. I started actually with the SARS outbreak. You know, you remember 2003, Hong Kong. So these 3 scientists, they did embark actually 2003 to find out about where is the first SARS coming from, and their thesis was the bats. And then they began to warn. After 10 years of research, they found the cave in Yunnan province where they could be quite sure that SARS originated. And they began to warn that another coronavirus will soon, might soon, you know, be spreading. So what I'm interested in this film is the role of science in increasingly dark times, you know. And I also tell the story how deliberate fueling and amplification of fears and evidence-free myths are driving our world out of balance. How did we get here? You know, why is the so-called lab leak now the official doctrine in the White House in US? Why did J.D. Vance, in his famous speech in Munich, as a climax of, you know, kind of criticizing Europe and our values, bring up the COVID origins and the lab leak as an example of censorship? Because from his point of view and the point of view of Steve Bannon, who is the mastermind behind these ideas, it is very clear that COVID was brought into the world by scientists. And my film, as I said, tries to give these three scientists a voice for the first time. So it means that Lin Fa Wang, you know, the bad virologist from Singapore, Peter Daszak, the NGO head of Eco-Health Alliance, who is now killed by politics, and Cheng Li from Wuhan. These are my protagonists. I give them a voice. This is not very typical in the media world. You know, as you know, most journalists kind of deal with this topic in a 50-50 thing, a little bit of lab leak and a little bit of nature or zoonosis and spillover. And that's just not how I then finally decided to do the film, because I think there is so much evidence for a natural spillover and so not only little, actually no consisting evidence on the other side for the lab leak. So I feel that I had to do the film in this way. So it's a reflection on the relationship between science, politics, and media. That's what I wanted to do. And we started the film in Nyon. That's a festival, a documentary festival in Switzerland. It was a huge success, standing ovation, and we won 4 festivals so far. But with this little pitch, and I would actually wish we could communicate that you ask me questions, because for me, to present the movie not without actually showing the movie is a little bit difficult. But the goal here to present you my film is that just to get your attention and, you know, attention economy, and to tell you a little bit about the background. So maybe you are interested to show the film in your universities, in your institutions. That would be what I'm trying to do here. One of my protagonists is a Swiss-Austrian science blogger. His name is Philipp Markolin. He wrote a beautiful book called The Lab Leak Fever. This is the German version. But I would highly recommend that you read this book, because when you read it, then you will see, and I asked ChatGPT to summarize a little bit of the Philipp Markolin thesis so that I'm fast here. But it's actually very interesting what Philipp Markolin says. We have to distinguish evidence versus speculation. You know, he argues that many versions of the lab leak theory are speculative, are driven more by fear, politics, or media dynamics than by solid empirical evidence. He explores which claims have been falsified, which remain unproven, and how ambiguity has been magnified. And he also explores the genomic evidence for natural origin, of course, you know, on the Huanan seafood market. And he embarks into the topics of media, misinformation, and information cascades. So how do media narratives, social media engagement, activism, confirmation bias, and algorithmic amplification have allowed weaker hypotheses to sustain traction? I mean, it's true. You know, today, 65% of US American people believe in the lab leak. It's maybe even more now with Trump, because it's really, it became the official doctrine. And as you probably agree, there is just no evidence, while there is a lot of evidence on the natural spillover. And, you know, the lab leak theory, and that's another thesis of Philipp Markolin, it has been used It has been weaponized by political actors. It has been a part of geopolitical rivalry, especially US against China. That was actually a huge problem for me, shooting this film, because we had to be under the radar of the countries we were actually allowed to shoot. Like, for example, in Thailand, we could not really be extremely open with what we are doing because of this geopolitical war. So the whole political dimensions of the COVID origins debate, I tried to put that in this feature-length, 2-hour-long film. And yes, I mean, I don't know if I have to really tell you how much I feel motivated by recent events. I mean, when you watch the film, you see RFK Jr., at the end of the film, he's now in charge for health. And I don't think I have to tell you how much science is under attack now in the US, but I'm telling you, actually, not only in the US, it will start also in Europe. So my thesis, to summarize all this, is COVID played a much bigger role, actually, than you might think in this far-right, ultra-far-right movements, also in Europe, because what it evoked, the amplification and the heating up of these speculations, it evoked this deep sense of a deep state. There somebody is doing something against us. And now the result is that we have to clean up, So we actually see these attacks on science and basically these attacks on evidence-based debates. So it's not so easy, by the way, as a documentary filmmaker, because we are usually on the other side. We are on the side of the ones maybe more not amplifying conspiracies, but we do like to ask questions, like many media. And now to kind of stand here and say, well, look, if you have 2 hours, watch Blame, and then you see the whole story from the point of view of the very 3 scientists in the middle of these feverish debates. And you see their logical thinking and their evidence-based thinking. So this is Blame, and I have no idea now if I'm already at 10 minutes or over, but maybe Miriam, you tell me, because actually I'm done, I don't want to keep you from dinner. And I think, Miriam, thank you for inviting me. If you would be so kind, if anybody's interested, just, connect them, please, to my little studio here in Zurich and to me. And I'm happily sending out some links about the films. And I would be really happy to do what we are going to do now in October, for example, in Bergen in Norway, where we present Blame at the film festival, but we are also doing a screening at the university and then have a debate with scientists about these fundamental topics.
Thank you, dear Christian. Thank you very much for the presentation on your documentary film. If anyone from the audience would like to pose a question, this would be the time. Or we head on to dinner. Oh, yes, there's one.
We have one.
Yeah, a very quick question. Is your film available in the cinema distribution system? Is it reaching the public, or is it going to be limited to festivals and university?
Yeah, thank you for the question. We are working on it. My most famous film, War Photographer, has been theatrically distributed in 15 countries. It has been on TV in 58, I think, countries. It became a classic. It is a little bit more challenging with topics like blame, because I'm not just feeding into a bubble. You know, this is a film which needs your help now, actually, the scientists' help to create awareness. So we just started 3 months ago and we are on the way. We are winning awards. It's going well. Go to my website. It's blame-documentary.com. You see the reviews. They're beautiful. All this is good, but so far we still need some more encouragement also for the theatrical distributors to be brave enough. I can to show this film to the audiences in the cinemas because it is very cinematic movie. You know, you will see behind me. You see this picture of these bats, but in the film actually we are flying with a drone out of the cave with these 2.8 million bats, and it's I think a visually very striking film, and I just hope you can help me to distribute it further.
Thank you, Christian.
So thank you so much. We will share the link with the colleagues and hopefully some of us can arrange viewing in our institution. Thank you for being brave enough to do it in this climate. So colleagues, this will end our sessions for today. And I hope you will have a very good night and a very good dinner. And we would love to welcome you tomorrow again at 9 sharp. We'll start. You can have coffee before in the break room. And then you can join us here at 9 a.m. Thank you. See you. Bye-bye.